Councilmember Starr and I said that we would meet with Director Patterson.
Yes.
And we met with you, when was it, about a week and a half ago?
Yes, sir.
Okay, and we discussed some systems and some strategies, and met at your table, and because I said we were going to do that, to discuss the outcome measures about dealing with children and lead. And you guys came up with some strategies, so I'm going to have you to explain that. Also, Councilman Starr would be here. He has another pressing obligation, but we're going to meet with you again on the 17th
Okay.
with another lead group. I think are you coming with us also? Wow, it's at 10 a.m. You know it's at 10 a.m.
Yes.
at your place.
Yes.
And I think it's with, he sent the message because it's in his ward. We're going to look at having, I think we'll have tenants involved and put together a group with CMHA dealing with the lead so that we can measure and monitor what you guys are, not saying you're a bad person, but what you guys are doing.
Understood.
And so on the 17th, we're going to roll that out. We need you to be there at the meeting. I'll forward you, because Councilman Starr set it up.
Yeah.
And we're going to need you to be
Maybe you
there.
can give a note to Cuyahoga County Police. I've been called for jury service, so we'll see if I can make it.
You know, I could never serve jury duty. They don't call me to serve jury duty. That's another story for another day. I mean, I'm there, but they always excuse me. But that's a story for another day, you know. But, which is good. I'm glad you're there. I'm glad you're there. You're good, and you're a fair person, and you're a person of good character, honesty, credibility, and integrity, which is very good. So let's move forward with your systems and plan, Director.
Okay.
And then I'll yield to you.
Oh, yeah, please.
Just want to go with this.
Mr. Chairman, Councilman, thank you for allowing us the opportunity to come in and speak with you about this very, very important issue. We received a couple questions from council in terms of what are we doing. The question was, what updates have been made to CMHA policy since the audit and conversations at City Council? So since that time, we've been engaged in a lot of communication and discussion with many different departments. I put on the screen here, you know, some of the things that we're doing is we're reevaluating our current approach, policies, and procedures regarding lead in our CMHA properties. We're engaging with our HUD field office, HUD Healthy Homes, the City of Cleveland Health Department, the Lead Safe Coalition, resident leadership, and other parties as part of this review. We will work to revamp our protocol of lead as it relates to non-CMHA-owned properties that are subsidized. CMHA has been reporting lead concerns to both HUD and the Cleveland Health Department as appropriate. We're engaging with our resident leadership and discussing outreach as well as informal and awareness training for our residents about lead. We want to pursue various HUD lead grants, as well as other funding opportunities that can be used to address lead abatement, removal on behalf of the portion of our estates that are eligible and in need. And then we want to advocate for funding to recapitalize our older estates in our portfolio. So those are some of the things that we have had some initial preliminary discussions about. We still have a lot to flush out. We're looking, again, to continue to partner and have those discussions with as many different groups as possible so that we can have the impact that I think we all desire. So that was the first question that was asked. The second question that was asked about the plans for, what plans are in place to expand testing access for families. Director Margolis and myself have had some conversations with direct medical providers to develop a plan to make lead and other testing for health for children available at our CMHA property. So we would actually conduct those sessions out at the different sites, particularly the sites where we have young children, and make that testing available to them. Regarding the lead testing of CMHA units in our properties built before 1978, CMHA has met with HUD's Healthy Homes office, the local field office, the Department of Building and Housing, Community Development, and the Mayor's led SAFE office to develop a strategy and approach to how this testing will occur. So we will go out and do some additional testing on our CMHA sites. We want to put some time and thought into figuring out the methodology, how we want to go about doing it, and making sure that we're able to get exactly what we want to get achieved during that process. So those were the questions that Council specifically asked me to address. Those are, Councilman, Mr. Chairman, those are some of the things that we discussed when we met earlier last week, and I'm prepared to address any questions that the council may have at this time.
You know what I forgot? Let me see. What do you do, sir? I'm sorry. Your name is what?
Jeffrey Wade, serve as Chief of Staff, Special Counsel to Mr. Patterson.
Okay.
Chief General Counsel Terry Mills, and the Chief Legal Counsel.
Okay, good. When you created this scope, sorry. Or you can say it again. That's right. I heard you.
I'm Chief General Counsel Terry Billups. I'm the Chief Legal Counsel for CMHA.
You know what? When we meet Thursday on the 17th, you're creating a scope, which means a lot to us. It's the scope. But I'm big and I'm huge on measurements. Mm-hmm. And I saw when the mayor was discussing the risk. He didn't discuss the risk analysis. He mentioned it. The mayor mentioned it, but the risk analysis means what if you don't say what are the risks and how you're going to measure the risk and how you're going to look at the dependencies of the risk. And, you know, I mean, I heard the mayor mention the risk analysis, but he didn't explain. He didn't go into details. So you have a staff there that would give us your risk analysis, and when we meet with Led Cleveland, we need to know that so we can measure to see where we're going to, because if you can't measure it and you don't know how to measure it, then you're going to get this, what we got right now. Mm-hmm. And even what we got dealing with Toledo and how they're moving forward, if he just said risk analysis. So who is doing that for you guys? And do you have a, let me see, and you got to tell us how you quantify what you quantify mm-hmm. in your risk also. Mm-hmm. That means a lot to me. So who's putting that together?
Mr. Chairman, we are currently in a process now of identifying someone to kind of help us. In that role, we did post for a position. So we're in a position of doing that. Mr. Wade has been, prior to him being our Chief of Staff and Special Counsel, he's also been our risk manager. So he oversees a lot of that work as well. So we want to try to bring someone else in and really kind of help develop that area a lot more within CMHA mm-hmm. So that we can have the impact that we'd like to have.
Excuse me, Dr. David Margolius, you, when you put that together, your risk analysis, when we look at risk, you're going to do a pre-testing as well as a post-testing.
Of course.
Right, to where you're at. Can you explain that a little bit? Even when I read the plain dealer yesterday, they didn't go deep into risk. Certainly. And I need you to go into it to tell me where you're at, so that way we can measure where you're going.
Of course. So good morning, Mr. Chair and council members.
Good morning.
One of the things that we discussed the last time we were at the table was that CMHA has what we think we know about our portfolio. Mm-hmm. But the process that CO Patterson just alluded to is that we're now going to go back and make certain of what the conditions are across the estates. So this will begin with a risk assessment of each property. These properties will have the full analysis to be evaluated by the XRF device, which will test for the presence of lead-based paint in components both on the interior of units as well as the exterior of units. They will take lead wipes to the extent that they're necessary. If a surface is not capable of being tested with the XRF device, they will take paint chip samples and send those off for analysis. What we have proposed is to exceed the HUD thresholds of, let's say for an estate with 100 units, I believe the HUD threshold is about 15%, and then extrapolate on your findings. What we have a consensus on, and we're going to do, is 100% testing. We want to know that every single unit has been assessed, the risks have been identified, that it's clear. Then the next step, of course, is to communicate that information both to our tenants as well as to the public more broadly.
I got you. Dr. Mongolius, do we have a quality control department? Because we receive grant dollars. We write proposals and we receive grant dollars. And if you have quality control, they monitor and control. They do pre-testing, post-testing, as well as they do an evaluation process on risk analysis. And we don't have to wait until the end of the year when we see an article or whatever come up saying we got a problem. But quality control will monitor the dependencies. Do we have that?
Through the chair, we've got that in a lot of different ways. So the articles over the weekend are in response to Cleveland Department of Public Health publishing the data on lead poisoning happening in Cleveland.
Right.
And so that's just one example of quality control that happens in this space.
Can you guys work with the health department with quality control? Because you'll see, I tell you, it drives me nuts. I think it's crazy. You wait until the calendar year, and then you say we have a problem. But if you know in the third quarter that you have so many people are being affected by lead, or in the second quarter, you measure that, you can get that to quality control, and then we can try to figure out a way how to stop the bleeding and not wait until the end of the year. So we can get that over to, from HUD, from CMHA to you, Dr. Mongolius. That would help us out.
So through the chair, so in each of the cases that are greater than 10 level of lead poisoning, our team goes to inspect the property as a form of quality control to see if there's a source of lead poisoning in a CMHA unit. In each of those cases, we investigated. We found no source of lead poisoning in those units.
You know what? Here's the other thing. When you look at the risk, we're looking at fresh paint, Chief Wade, and how sometimes each department, each apartment is not the same. You can have people tracking in something from elsewhere, from the exterior for, let's say, for example, you had a dry cleaners, was raised, demolition, the kids out there playing in lead, they track it into the house, or a gas station that's just been demolished, and you carry it into the house. So risk, you gotta look at the external also, and that need to be in your risk analysis. So what are you thinking, Chief?
Well, I think that one of the things that we touched on previously and that we're going to stress is just a return to information, to raising the awareness of families. Right. I think it was rightly pointed out in one of the articles over the weekend that you only know the condition of a unit at the moment that you've inspected it. Once you stepped away, your knowledge, your information has changed. So one of the things that's a key aspect of this work is to inform those who reside in these properties about the need for, to maintain, to wipe the windowsills, to mop the floors, to do the things that will begin to mitigate the risk that you were just describing. Because as I think we've all discussed at length, the presence of lead in the city of Cleveland is prevalent.
Right.
It's in some of the ground soils, so it can be tracked into units. So the question is, how do you account for that? How do you respond to that? And one of the ways I think that you do that is through the information, the sharing, and to ensure that those that have the greatest ability to affect this, which are those that reside in the apartments, have that information and can do that.
Director Patterson, what I'm thinking, you meet with your staff and you get quarterly reviews or monthly reviews, and being that this problem is huge in the city of Cleveland, what I'm thinking is that you should always have a report when you do your strategy reviews about lead, and it should be brought up in that report. Because I'm disappointed, not just with you guys, I'm disappointed with the whole piece. Why did we wait until the end of a calendar year and then we start discussing? You see things while it's coming. You see it. And if you have a strategy review and you're talking about it, you're discussing it, you see problems. Dr. Margolius, you see problems before it even comes. Why wait until a calendar year and you say, well, we have increased numbers of lead issues? I mean, if you see something that's out of the norm or there's a glitch in your strategy, then you say, uh-oh, I need to, because leaders have to be able to see around corners. You have to say, uh-oh, there's an issue. Let's see what CMHA doing. Let's see what's going on here so that in the first quarter or second quarter, we can start making adjustments. It's even like that with legislation. If you don't manage it, it'll go crazy on you, and things change, and it's moving. And I don't know why we wait, and then I'm yelling at you because it's driving me nuts. I'm really boiling up. I'm really upset, and I'm disappointed.
Through the chair, you should be disappointed. You should be frustrated. I hope we all are. I hope that's why this room is packed today. We're all there. We've been talking about this, obviously for decades, for lead poisoning, and we've been sounding the alarm at the health department for years. Hundreds of kids are being poisoned in Cleveland. And so that's why we're here to talk about, what we can do to do better to reduce that number. But absolutely, you should be frustrated. I appreciate that.
Well, I'm going to say this. It haven't been. The reason the lead is before you came, is over in community development because that health department was not efficient. So I don't see that we were sounding the alarm. And it's not against you. You have the baton. And you and I, we walk sometime for 2.5 miles and we discuss. We go for walks and we discuss. He walks through the neighborhood with me, director, and we talk about issues and concerns. And I even wake him up sometime at 2 o'clock in the morning when I can't sleep. And I wake him up, and I do, 2 o'clock in the morning. And we talk about issues and concerns, and then I'm able to go back to sleep and meet with them later. So this right here is very, very important. I think, and I'll yield to my colleagues, that Wade, you mentioned that Chief Wade is your risk analysis person. You probably need an expert. You need an expert, and you need to work with the city of Cleveland first with Dr. Margolius, and we need an expert for quality control. Because if we wait for you, your span of control, it's not there. And I'm not putting it on you, but you need an expert for expert opinion.
And Mr. Chairman, that's the position that I mentioned that we were trying to recruit for, and we also are going to be looking at bringing in some advisors to help us with this as well. A lot of what we're doing right now is just having conversations, putting things together, and really trying to come up with a comprehensive approach. We don't want to do just a Band-Aid. We want to have a real comprehensive strategy for how we want to address this going forward and make sure that we take the steps to be able to do it and work in partnership with others to be able to get the funding and secure the funding to be able to do this. Because these things will cost additional dollars.
Right.
And we want to make sure that we have the partnerships and the collaborations to go out there and be able to get that funding to be able to do this work.
Yeah, if you have quality control, it will pay for itself. The only way you're going to get funding is to have a good evaluation. That's the only way you're pre-testing and you're post-testing. If that evaluation is not good, because you could even sell an evaluation if it's a good evaluation, so get the expert in and we'll discuss that.
Understood.
Later. I want to yield to my vice chair. And I'm really frustrated, but I'll talk with you on the 17th. I must use emotional intelligence. That's very important. So, Vice Chair.
No, thank you, Chairman. I think we're all here today because we are just so deeply frustrated. And all of us in this room, no one wants to see a kid poisoned. And yet it's not just 1, 2, 3, it's across the city. And so there are multiple partners here today. And CMHA, I'm grateful for you returning after our conversations this summer. If I could dive into some of the bullet points that you went through. Mr. Wade, you mentioned getting to 100% testing standard for CMHA units. Is that accurate through the chair?
Through the chair, yes, ma'am.
Thank you. And could you tell us a little bit about the conversation about the standard of testing is something that we're going to be talking about a lot later today. And HUD, of course, outlines a number of different standards, lead risk assessments, lead screenings, surface-by-surface analysis. Could you tell us a little bit about what standard of testing you're saying all CMHA properties will go through the chair?
Through the chair to the councilwoman, the standard that CMHA will adhere to is that which is required by HUD, which is to examine all the interior surfaces, all the interior painted surfaces of a unit, as well as all the friction surfaces. So you basically will go walls in, and then where a unit either has an access point to the exterior of the building, you're testing that. You'll test the common areas as you approach that unit. For example, walk-up units, you would test from entry door up to the point of entry to that unit. For the exteriors, you'd be testing for window lintels, door lintels, those of our units that have balconies, the balcony surfaces, the rails. So it's a comprehensive evaluation for the presence of lead.
Thank you. I apologize. I turned off my own microphone. Thank you. In my traditional understanding, when we talk about that level of surface-by-surface analysis, I'm trying to bucket it into the traditional HUD standards of testing, a lead risk assessment, a lead screen, surface-by-surface analysis. It sounds like you're saying you're going to go to a surface-by-surface analysis for the units through the chair.
Through the chair to the councilwoman, that's correct.
Thank you.
And
thank you.
through to the councilman, through the chair to the councilman, as we go through this process, if there are other methods, other mechanisms, other suggestions that folks have in terms of additional things that we would like to do, we want to sit down and have those conversations. One of the reasons why, I talked about at the beginning, coming up with the proper methodology is for us to take that time to make sure that we have something that everyone can be comfortable with and get the voices of others to weigh in on those decisions.
Thank you. I really appreciate that, Executive Director Patterson. And to that extent, I would love to hear a little bit about your expected timeline to move to this higher standard of testing. So what is your goal to complete that full survey of CMHA properties with a surface-by-surface analysis?
Well, Mr. Chair, to the Councilwoman, we are hopefully being able to do that in the next 3 to 6 months. We want to still have to wait on our report to come back from HUD. We still will have to go through a process to develop that scope of service. We'll still have to bid those scopes of services out, get those bids back, review those bids, select contractors, do contracts, and then go with that work. So,
Okay, and you think that's all going to happen in 6 months through the chair?
I'm going to push as hard as I can.
Yeah.
And hopefully with the support of many others, we want to be able to try to do that. Now, if it goes a little longer, for me, it's up to me and my team to make sure we communicate that to everyone, that this is what we're doing. And I am completely fine with us sharing with you our progress in this. The council, the chair said that he wanted to have some level of monitoring. We're completely fine with having some type of monitoring where we report those activities as we go forward.
Thank you. I think some type, maybe a quarterly or every 6 month update on that process, because that will be a change and a substantial lift as we're trying to address this issue across the city.
That's fair.
I want to move secondarily to to scatter site, to Housing Choice Voucher Program participants and other single-family properties. What standard of testing is currently required at a Housing Choice Voucher Program location? Through the chair.
Through the chair to the councilwoman, that is a successful lead clearance test.
Okay. And is that as part of the housing quality inspection, or is it done separately from the HQS through the chair?
Through the chair to the councilwoman, that is separate.
Okay, and are you confident that it's completed in 100% of rented housing choice voucher program locations in Cleveland?
Through the chair to the councilwoman, that is our standard.
And through the chair, do you believe you're hitting that standard?
Through the chair to the councilwoman, we believe so. One of the things I think that your question is provoking is this quality control process, which is to evaluate that and to assess for it. That is something that we're going to work towards.
Okay, so through the chair, I hope you understand that sounds a little bit, I don't want to use the word like a slippery answer, but it sounds a little bit like a slippery answer. What I want to understand is how are you currently assessing whether you hit a completed clearance exam for 100% of housing choice voucher program locations through the chair?
Through the chair to the councilwoman, I think that it's certainly not meant to be slippery. What it's meant to convey is that we need a more rigorous quality control process on that aspect.
So through the
while-
chair, I'm just going to interrupt you. You cannot say right now that you are at 100% clearance exam, completed clearance exams for housing choice voucher program locations.
Through the chair to the councilwoman, no, I cannot.
Thank you. And through the chair, what's your
Question?
absolutely?
You're gonna, to the, to the chair. No, I like to have you, you're young, so it's my job to work. Here's a, you mentioned quality control. I understand, you're gonna put that in your system so they can evaluate it. And that way, when you monitor and control it, you're gonna give it to council so that we can see where you're going. Is that correct?
Yes, Mr. Chairman.
Mr.
That would be a
point.
part, pardon me. Mr. Chairman, that would be a part of our quarterly update to council.
I'm going to yield in 1 second. And then the same thing with you, Dr. Mongolius. You guys have to give us, we heard the mayor talk about a risk assessment, and you're going to have to let us see, because you can't just tell me you're going to do it, and I'm not reading your evaluation process. We have to be able to see that, to study it, so council would know, or we won't be able to have oversight. So we need that. You can put that down. I'll yield to you. It was your line of questioning. Is it okay to yield to the council? For a
thank-
point. Want
thank
us to
you.
put you down also, Councilman?
Yes, please.
Yes, sir.
Thank you, Mr. Chairman. Thank you to my distinguished colleague, Mrs. Maurer. I'm just trying to get a grasp in my mind as we talk about the units, Mr. Chairman. How many CMHA units are we talking about that you're going to be going through this process, right? And then we talked about the vouchers. So how many vouchers do we have? So what are we talking about in terms of the broad scope of things?
Mr. Chairman, to the councilman, we have over 15,600 housing choice vouchers overall. We have another 10,500 affordable housing units throughout the city.
Thank you, Mr. Chairman. That's it.
I'll yield back to you, Madam Chair Lady.
Thank you,
And
Chairman.
Madam-
Yes.
Mr. Chairman, to the chairwoman, as we put that bullet down for that purpose of getting to exactly what you're saying, and I use the word revamp on purpose because
Yep.
that is exactly, I think, where we may need to go.
Thank you, and I appreciate that. And to that point, I'll also ask whether you're at all considering changing the standard for housing choice voucher program testing, because we're going to be talking a lot about levels of testing today, and that surface by surface analysis that you're talking about within your units is seen, and it really is quite a higher level of testing than a clearance exam. So are you at all talking about moving up the standard of testing for housing choice voucher program and other scatter site locations through the chair?
Mr. Chair, to the councilwoman, we're very interested in having that conversation.
Okay. When are we having the conversation? Because I think we're having it right now.
Well, we're going to start to get deep into it next, the 17th. I want to make sure I have opportunity also to talk with HUD and include them in the conversation as well, making sure that we're not doing one thing when they're requiring us to do something else.
Yeah, I
So-
agree with that. I think one thing I do want to appreciate and emphasize for people is like you have federal standards that you're trying to meet, and so we don't want to add in additional layers that compete or conflict with those federal
You
requirements.
and I are aligned in the spirit of what you're saying. I just
Yeah.
want to make sure that we can, you know, be able to fulfill those requirements without violating others.
Yeah, understood. I know we have a lot of people eager to get on, and then we have substantial more to get through today. So I'll be, my last question is around the commitments to lead testing available at CMHA properties. And I want to know what your timeline is to complete these 2 bullet points, working with the Cleveland Department of Public Health and direct medical providers to develop a plan to make lead and other testing for children available at CMHA properties. So we're looking for a plan. Our next step is the plan. What is your timeline for the plan?
I will hopefully be able to get that plan together within the next 30 to 60 days. That would be our goal. We want to make sure that we know where we're going to test, how we're going to test, how those tests are going to be paid for, and so that's going to take a little bit of time.
Thank you. And so it sounds like before the end of the year, we're going to be looking for some type of report out about the testing.
That's fair, Council.
Okay, thank you very much. I will yield to my colleagues.
We'll go to, before we go to Councilmember Chris Hirsch, before you get to that plan, you have to show us your implementation. How you plan the implementation when you do your risk analysis, then we'll get to the, then I want to see the plan.
Understood.
Because without the implementation, you take from your implementation to create the plan. You see what I'm saying?
Understood.
And then you work with your other key stakeholders. Councilman Chris Hirsch.
Thank you, Mr. Chair. I think most of my questions are going to be for Director Margolius, but I think you're doing a separate presentation through the chair to the director in a few minutes, so I'll hold off on those and we'll just stay with CMHA. Through the chair to director. Director.
That's fine.
Esteemed gentlemen. I have 3 children. They were all born using CareSource as our healthcare program, and I believe the CareSource is the primary healthcare insurance program for the majority of CMHA residents as well. That would probably be accurate.
Mr. Chairman, to the council, I know that there are a lot of folks that utilize CareSource. I just don't have a good idea of the range, but I think that a lot of folks do utilize it.
Okay, well,
Through
Mr. Chair, the reason
the chair, I'm sorry. It's
Yeah.
Medicaid is probably what you're thinking of. CareSource is one of 6 right now Medicaid partners, and so most folks have Medicaid. Yeah.
And so my question then is going to be sort of regarding that. So I believe it is one of the options that a lot of people use. Through the chair, are you familiar with CareSource's procedures for testing children for lead when they go in for their routine medical checkups, after birth?
Mr. Chairman, to the councilman, no, that's part of our evaluation process now. We want to look at the different groups that perform that type of testing and making sure that we understand what exactly they're testing for and that it's meeting the standards of what we're looking to have done.
Through the chair, does CareSource or any Medicaid program share information about children living in CMHA facilities with CMHA directly?
From the chair to the councilman, no.
Okay. So, right. Well, probably HIPAA laws, but
Okay, yeah.
probably.
Just the lawyer.
But my point is to clarify, Mr. Chair, that they are not sending you direct information about children in CMHA because I believe, and we'll get into the director, that all Medicaid insurance programs are required to provide and offer lead testing for all children in the state of Ohio. But that information would not be shared with you.
Through the chair to the councilman, the only exception would be if you had a positive lead test. That would be communicated or should be communicated, but any other information would not be.
Through the chair, just like they would notify the city's Department of Public Health if there was an elevated blood lead level, the state notifies the city, the state would notify you as well if there was an elevated blood lead in one of your units.
Through the chair to the
LVEL.
councilman, yes.
Okay. Through the chair, do you all feel from your experience that CareSource and Medicaid are doing an adequate job of testing children for lead? Is it a thought you've had or something you've kicked over?
Dr. Margolius?
I'm curious how the CMHA officials, we're going to spend lots of time with Dr.
Through the
Margolius.
chair, I just want to clarify, it's not, Medicaid is not doing the tests. They're the insurer. So
Right.
the providers in Cleveland do the tests, then Medicaid reimburses them.
Okay, the providers on this network, through the,
Which it would be all the big healthcare systems,
Right.
FQHCs, so that's,
what are your thoughts on a lot of your, people who live in your units, use these healthcare networks, should be offered lead testing for their children routinely. Is it your experience in your work that that is happening or not happening, or happening sometimes, or happening none of the time, or a little of the time?
Mr. Chairman, to the councilman, I think that's part of the reason why that bullet is on the presentation. By working with these organizations to create the opportunities for these tests to be given on our sites, we can see that level of activity. We can see if folks are participating and being a part of it. Right now, that a lot of that testing, those tests and things like that are done individually between the parent and the family. For us to be able to do this and be able to specify that we'd like to have people be able to come down and do this testing at our sites, the same way that we did when we did for the pandemic, where we had people
like
come
that.
in and get the vaccine, or to be able to come in and get tests for COVID and things like that. We were able to kind of see the impact because we could see people coming down and doing it. So I hear what
Yeah.
you're saying. I think that what we have here is an approach to try to really be able to get that. And I think, as the director said, it's CareSource, it's probably Care Alliance, it's any of those groups that are able to provide that service through Medicare are the ones we want to talk to.
Mr. Chair, the reason it's interesting to me is because lead poisoning is where housing and healthcare intersect. Quite frankly, in America, they're related concepts. But if housing and healthcare don't talk to each other, it might be more difficult to understand where the problem comes from. Through the chair, does CMHA have a legal responsibility to monitor lead levels of residents in your facilities?
Through the chair to the councilman, not a direct responsibility, but this conversation is provoking the fact that, of course, to the chairman's point, that if we're seeing repeated instances of elevated blood levels in children, then that needs to provoke a response based on the conditions that are being observed by us. But there is no direct responsibility to, for example, to have access to, much less do we have the right to have access to a family's medical records or, that type of information. It depends on the flow of information, to your point, from the CDPH, from the providers themselves, and from the families.
And my last question then, I'm sorry, I have two more questions. Through the chair, do you believe that CMHA has the capacity to monitor lead levels of all children in your housing buildings?
Mr. Chairman, to the councilman, I don't know that we have that capacity as it stands right now. I think we have to kind of work with the health department and others to figure out what is something that we are able to do and put something in place to get a foundation going.
Okay. Then my actual last question then, Mr. Chair, is do you know what percentage of children living in CMHA facilities have been tested for lead?
Mr. Chairman, to the councilman, I'm not aware of that.
I don't know what percent. Okay. All right. Thank you.
Is that it?
Yep.
Great questions, Councilmember Harsh. Councilmember Joe Jones.
Thank you, Mr. Chairman. One of the questions that was brought up earlier on the point was the number of units that I would presume, and this is going to go through a process of inspections. Is that correct, Mr. Chairman, to the director?
Mr. Chairman, to the councilman, yes.
Okay. So in the proposition, just to make sure I'm clear, the first 10,500 units that you actually house people out or that you're actually directly in control over, you're going to be monitoring, you're going to be taking tests to deal with those units to make sure that they are lead-free?
Mr. Chairman, to the councilman, we're going to take those 10,500 units, we're going to break them down into different categories of housing, and from that point, we're going to go through and conduct some testing at those units.
Okay. And then will HUD be helping to pay for or defray the cost of doing this? How would you get the funding to be able to do this? Or would you have to, Mr. Chairman, go through your own means to do it?
Mr. Chairman, to the councilman, that's a good question. And that's something that we're going to be looking at as we go through this process. But we do know that it is necessary And with this necessary type of thing, we have to figure out how to get it done.
I see. And then the next question on the vouchers. Once you finish with the 10,500 units, you have 15,600 vouchers. You do have inspectors, Mr. Chairman, that do inspect these properties before these properties are given out to, or these vouchers are handed out to people to go and move into these locations. Will this be a part of that new inspection process that they would actually have to test for lead as well?
Mr. Chairman, to the councilman, that's the process that we're talking about for vouchers that we want to kind of revamp. So we'll be looking at how we're going to actually do that process going forward.
And here's my concern, Mr. Chairman. We have a number of LLCs that are buying up and purchasing houses like we have never seen before in the city of Cleveland. And, you know, I've sat here and talked about this on a number of occasions that I'm concerned with these corporate systems coming in play and buying and purchasing properties. So it would be nice to see, Mr. Chairman, how we approach this situation in terms of accountability. And then the next question is, I know that we have, we set up some new rules here to hold accountable people who are, who have LLCs, who live out of state, and then to hold them accountable in terms of occupancy and checking up on them. I didn't know if maybe the health director might have something to add to this, or how we would work with dealing with this issue.
Yeah, through the chair, we'll have a presentation just across the board on the work that we're doing there.
So it's coming forth today? Today. Okay, well, that's excellent. So I won't belabor the point. I just think that we have a good director of CMHA, and I would hope that you would really push hard on HUD to bring the resources in the city of Cleveland and deal with this issue. And Mr. Chairman, this is an issue that goes back all the way to the 1990s. We sat here at this table and talked about lead poisoning and its negative impacts. And Mr. Chairman, back at that particular period of time, we were not successful as a city to really fundamentally deal with it. And we had to send money back to the federal government. So, you know, for me, Mr. Chairman, I think it's important that we ask for assistance from the federal government. This is an issue of its citizens, and our kids are being poisoned from one generation to the next generation. And it seems like this situation has been pushed up under the table, out of sight, out of mind. And I remember sitting here, Mr. Chairman, talking to one of the chiefs of the last administration that told me that there was nothing that they could do to deal with the lead issue. Because, and then she looked at me, she said, it's in the pencils, it's on this table right here, it's in the soil, there's no way we can clean this up. And I was left, Mr. Chairman, stunned by her comment to me, because I had to sit on the other side of the table because it was budget hearings. And so I was sitting next to her, and I was, of course, when I sit next to folks, I ask a lot of questions. And so while I was asking her those questions, I was shocked with her response. And so I hope, Mr. Chairman, that as we move forward on this issue, we critically take it to heart. And I've even sat here and talked about babies being tested at our local hospitals that are born and that come out and be in these environments every so often. They should get tested. So we should, if we want to know just how bad this issue is, we should be testing young people, infants, kids, before it gets to a situation where they're exposed over space and time, and then we have some of the problems that we've heard them talk about, people who are exposed to lead in terms of development. So this is very critical, Mr. Chairman. I know that the director takes it serious, and I'm appreciative that you're here at the table and that we're having a conversation about it, and we're talking about putting together programs that will actually help our people, because our people are in need, gentlemen. And we need to do everything we can, and we just don't need to just talk about it and then don't do it. Because we've been here at this table almost 30 years ago talking about this issue, and it's a shame, and it's awful that we're sitting here today still talking about the same issue. with a whole group of new people on both sides. So, Mr. Chairman, I yield the floor. I just wanted to make that statement, and I hope that we don't be talking about this in another 30 years.
Councilmember, did you ever respond before I yield to Councilmember Slife? Sir?
Thank you, Chair, and thank you, Councilman Jones. I kind of share that this issue is so large. It's easy for it to become so overwhelming that you almost want to shut down. We can't shut down. We have to keep charging forward. And to that end, I also have a lot of questions about testing, which I'll hold for the health director. And you know, I think looking at kind of the maps of testing and areas of density, it seems that the CMHA estates most likely aren't our biggest issue here. Like there's like even like in Central, for example, it's a lot of public housing in Central is not one of the hottest spots in the city. But I think what's frustrating or we find you know to be something that's challenging that maybe shouldn't be a challenge is that we know these are places where people have an engagement already with government. We have kind of it seems that this would be a place where there's more easy back and forth versus someone renting to an LLC. So I think that's where a lot of these questions come from. Mr. Wade, you had noted that you know there's a lot of things that we can do in our own homes around kind of cleanliness and things to you know prevent these points of friction from exacerbating and things, and that's all true. And I think that we should simultaneously remind people of that. But I don't want people to walk away with any kind of suggestion that we're saying, oh, well, it's because like, you know, poor people just need to stop being dirty, because I don't think poor people are dirty. I don't think there's any sort of parallel relationship between income and what the condition of your home looks like. So kind of with that in mind, can you explain to me, if I were a CMHA resident and I had a repair that needed to be done by the property owner, how do I make that request? And if there is a child in the unit, is there any sort of priority given towards repair requests that may be related to some sort of lead vector?
Through the chair to the councilman, the process to request work in an apartment is there's a number of ways that they can do that. They can speak directly to local property management on the site. They can call the phone number to request that work. You can engage with any member of CMHA staff to activate that request. But to go to, I think the question that you're provoking is, if there is a child under the age of 6 and there's a condition in the apartment that involves deteriorated paint, that then goes through our risk assessor to ensure that as those repairs are completed, one, they're done by staff that are certified to do the work, that have the lead renovation, repair, and painting certification. 2, that it's then assessed by our certified risk assessor. And 3, that she clears that unit following that repair.
Okay, so thank you for that. So I guess to build on it further, is there any sort of priority? So like say like my baseboards are all scuffed up because kids keep running stuff into them, and I'm saying we need to paint over these. You know, that seems like a relatively minor repair. Is there any sort of priority given to that repair being made by a mother of an infant versus a senior in a high-rise who has an issue with their stove? Like, do you triage essentially the needs for service requests, or is it more of a first-come, first-served system?
From the chair to the councilman, it's a great question. So our current hierarchy is to prioritize based on life safety conditions. So in the winter, no heat. In the summer, no cooling, no water, backed up sewage, those types of conditions that would make the apartment uninhabitable. What you're provoking is something I don't think that we've ever thought about, was to bring that down to another level and to tie paint conditions to, does this component, whatever this is, whether it's the baseboard in your example, does that baseboard contain lead-based paint? And then to build that into our hierarchy for that type of response. The present, it's not there.
Okay, I think that'd be something. It seems logical to me. I'm a bit of a layman in all this entire topic, but it seems like something worth exploring. Another version of that, I think. And my final question, if, let's say, a young woman is living in a unit that we know has lead, there may be no current exposure issues, but if she were to tell CMHA that she were expecting, is there any ability to kind of prioritize the movement of her into a newer lead-safe unit? And is there an ability to try to just make a concerted effort to minimize the number of children in the legacy units where lead could be an issue at some point down the road?
Yeah, you talking prevention. Sir, Director?
Sorry. Go, repeat that last part of it
'Cause you were
again.
right.
Sure. It's essentially, if is there any possibility, or could we explore a system where we can prioritize the relocation of people who have young children or are expecting into newer units, so that the children are just not living in the physical environment where there's pre-1978 conditions? I don't know if that exists or if it could exist, but it seems that if there's a way to proactively just remove the people from the exposure, that would obviously be beneficial. So,
It's definitely something that we can explore, Councilman.
okay.
You know what? We should take a look at that. You're right. That's great. Because what you're narrating, you're talking about council member prevention, and to look at that, maybe even when you know someone is pregnant, in one of your units, we look at prevention. And that's what he's discussing, and I like that. That's important, so we want to get to where we're at now. Yeah, so that prevention is important. Did I cut across you, Councilman? No, you're good. Okay. Councilmember Gray.
Thank you, Chair.
Yes.
Thank you, everyone, for being here. Just to have a question to the director right now. How long have you been president over a CMHA?
Mr. Chairman, to the Councilwoman, 13 years.
13 years, okay. I just want to say this. It's just looking at the information you have up there, and I know we're talking about housing of the lead, all the homes that have been built before 1978, they have the lead condition per se. I just want to say this, that CMHA housing was one of the first places that my twin sister and I moved in the late 70s. So just to say that, and the office was at 30th and Cedar. And at that time, CMHA the Cedar Projects was one of the best housing projects that you was able to live in at that time. And my twin sister and I lived there for 5 years. So at that time, we did raise our sons there, along with some other family members that lived there at that time in the Cedar housing. There was no rhyme or way of no lead problems at that time when I lived there, because they were very efficient. They took care of the units. They came in and inspected the units at that time. So just say the least, during that time, as I recall, there was no lead problems. But I know over time, as we get to this point, it has evolved into a crisis. And I know, just fast forward, just to say the least of what's going on now, when I came into the lead resource team with Director Kim Foreman and her partners, I came into that program dealing with the highest lead cases was in Glenville, and then in Clark Fulton, and then in Buckeye Shaker, Buckeye Launchmere per se. So just to say the least is that we have done a lot of research in every area of Cuyahoga County, and not to demean that, what's going on with CMH housing, just to let people know that I lived there in the late 80s, and there was nothing wrong with CMHA housing during that time. But to evolve where we are now, we just can't say where the kids are having this lead situation in one particular area. When we know it's spread it across, the whole region. So we have to look at this as a broad. We looked at Glenville. Matter of fact, I would like to have the assessment on Glenville when I was there with Kim Foreman and her partners. I can't remember, what was the final assessment that we should have received in that particular area. I can't recall when the final assessment, that I received in the Buckeye Woodland area. And now we asking, what's the final assessment for CMH housing. So we have to look at everything abroad on our children, on our children having this lead testing. So we have to, understand it's not one location, it's all locations. So I'm just gonna, I don't have a lot of questions because I'm not gonna be redundant. With these questions that you all have already been asked, I'm just going to stay on board with, the assessment, of what's going on with, with CMHA housing. I yield, Chair. Thank you.
Thank you. You know what? I respect the council lady, but this is how I think. When there's an issue somewhere, if you don't deal with the issue or do prevention, then what happens, you end up getting 2, you end up getting 3, you end up getting 4, you end up getting 5, and then you don't wait and then start dealing with it later when you have 5, 6, or 7. You deal with things so that it does not get out of control. And I'm not gonna say, in all respect, Council Lady, you're in this paradigm where it's 1, 2, 3, 4, 5. But if we if one child is lead poisoned, it affects the entire community, the entire city. So if you see that there's an issue, then you go back and you say, so what is this problem? Is it in the water? Is it in the soil? Because then what happens, another person, and then another person. So I think differently. I think totally different. My whole focus is on prevention, and anything that we can do to help. Also, when we meet Thursday, you got to tell us, can we lobby the $100 million funding? Because it's taking forever to get that money out. Can it go toward it? Because you're in Cleveland, and it's still Cleveland children. And it's our job as legislators is to write policy for people, not just in our wards, for people that live, work, and travel through the city of Cleveland. That's our job. Not to just look at Glenville, Hough, Fairfax, but for anyone that live, work, or travel through the city of Cleveland, try to make the quality of life better. So I say that when I meet with you at 10 a.m., you say, council member, we need to lobby downstate. We need to talk with the state reps or the state senators or the governor, or whatever the case may be, because they're in this also. You're not just voting for the council member. You're voting for all of them. So we got to work for the good of the whole. Or even can we take some funding from that $100 million funding to benefit so we can do prevention? I mean, that's just where I'm at.
Mr. Chairman, we look forward to that conversation and working with you and the council to achieve those goals.
All right, any council member that would like to come at 10 a.m., your place, on Thursday, on the 17th, we're open. We're working, it's a working session, so we'll do that, all right?
Sounds good.
Any other questions? All right, we will see you Thursday on the 17th at 10 a.m. at your place.
Sounds good. Thank you.
Thank you. All right. Top letter. See you later, Wade.
Yes, sir.
So, I enjoyed playing at Wade over, Wade. So, Dr. Margolies and also the Director of Community Development, Hernandez. Is University Hospital here? Okay, I'm gonna meet with you and introduce you to Jones so we can get you in there. And you guys did a good job with me last week. What was that, Wednesday or was it Thursday? Thursday. So look at that.
Could you call all the directors?
Yes.
Good morning, council members.
Good morning, buenos dias.
Buenos dias.
Buenos dias. Ayana Blue. She's coming up. Oh, yes. No, you're coming up separately. I'm going to ask a few questions, and then I'm going to step away for about 10 minutes. I have to do something, and then I'll yield to my genius vice chair. Yes. But I'll listen to you on the monitoring machine, and I am coming back because this means a lot to me. You know, if I wake people up at 2 o'clock in the morning, it means a lot. I text you sometime.
You do.
I text you sometime, Director. You know, send a text. Glenville, Councilwoman Gray mentioned Glenville. I need to know, and you just send it to me, the outcome measures. I think we have a $9.7 million grant there. And when I see about the east side, Glenville should be hitting their benchmarks. It should be hitting its numbers. And I need to know where we're at. Can you, if you can't speak to it right now, give me a report later today.
So, through the chair, we've got 3 presentations, public health to kind of set the stage, building and housing,
Okay.
and then community development to talk through all the grants. So I think if you're gone 10 minutes, you'll be back in time for the full community development presentation.
Then I'll go meet with her. Cool beans. I'll yield to you. My genius vice chair.
No, that is. I am
But you'll
very
listen,
aware.
you're going to listen.
Oh,
You want us later, though.
you'll be on TV in the office. My assistant is back and
Oh, okay. All right, well, let's stay. Sure, it's up to you.
yeah, Director, you could have stayed up here.
Well, then she can work, so she'll work on a lot, you know. That's good. I'll do whatever.
All right. Thank you.
You chair.
No, thank you. Director, I know, unfortunately, one of our great leaders, Emily Collins, is not here today, and so you have big shoes to fill, but I think you are leading our way, so please go
Thanks.
forth.
Yes, through the chair, thank you, members of City Council. So we have 3 presentations from the city today. We'll start with Department of Public Health, then we'll go to Department of Building and Housing, and then we'll go to Department of Community Development. And some of the news that we released at the end of the week and into this weekend were ignited by data that we're presenting from the Health Department, which I'll show you right now. So thanks to our epidemiology team in public health and Vintrin, our epidemiologist who's focused on lead poisoning, among other things. Lead poisoning in the city of Cleveland has decreased dramatically looking back to 2005. So what you're seeing on the screen is the percent of kids under 6 who are tested who have a level of greater than 3.5 micrograms or deciliter or above. That progress has stalled in the last 5 years. So 52% in 2005 of kids who were tested had a level of 3.5 micrograms per deciliter or greater. And then just for the last 5 years, as you can see, we've been hovering around 18%. Nearly 1,500 children are referred to the health department every year with a level that's 3.5 micrograms per deciliter per greater. What's new about this data is I think this is the first time we've looked back at this 3.5 micrograms per deciliter level, because every few years the threshold changes based on what's going on in the rest of the country. This is the 97.5th percentile is 3.5, but as you can see in Cleveland, 1 out of 5 kids are testing at this level. So that was our punchline in seeing that still so many kids are being poisoned by lead despite all the good work. And we're here today to not only sound the alarm given our concern of this high level, but also figure out what we can do collaboratively between us, between City Council, the Lead Safe Coalition, other partners who are in the audience to figure out how to start to see year-over-year improvements in lead poisoning. Some additional data. So that black line on top is the city of Cleveland's lead poisoning rate. Now we're looking at a greater than 5 micrograms per deciliter level. And as you can see, we're more than 2 times as high as Detroit, who we won in baseball over the weekend, and Toledo, Akron, Cincinnati. And when we look at Milwaukee, Pittsburgh, other peer cities across the country, we're much higher. Flint, Michigan is not on here, but we're 2 to 3 times higher than Flint, Michigan was at its peak. And in Cleveland, it's all from the lead paint and not the water like it was in Flint. And we acknowledge that even with this high number of children testing positive for lead poisoning, there are a lot of children specifically on the east side who are not being tested. And so this map shows the disparities in testing across the city, where testing rates are very high relatively on the west side, but remain low on the east side. And with those different testing rates, we do have still very high positivity rates in the east side neighborhoods and many of the west side neighborhoods. And there are a few neighborhoods that have much lower testing positivity rates, but as you can see, higher rates of lead poisoning are generally on the east side, but don't spare the west side. Now this map is looking at each of the nearly 1,500 cases of lead poisoning across the city in 2023. Each dot represents one child who's tested positive for lead poisoning. Now, the dots are randomly placed in neighborhoods so that they are HIPAA compliant. In other words, if you line up the map over a real map of Cleveland, you're not going to see the exact address of where a kid lives because that would be violating that family's privacy. But the dots tell the story of where we're finding the most cases of lead poisoning. And so in line with the last couple slides, certainly there would be a lot more dots, we assume, on the east side if our lead testing rates of children were higher on the east side. But that doesn't discount the fact that there are still 1,500 dots, and many of them are on the west side and may not recognize that this is a all of Cleveland problem. And that is my last slide. So I think it's probably time for questions about those slides before we move on to building and housing, if that's okay, because I know folks had a lot of questions about testing.
Yeah, I think that's right. I already have Councilman Slife on the list.
So a couple questions. One, and I'm going to ask it now, but it's sort of at the intersection of you and building and housing, so I don't know who the right person to answer, but are there any data on, of the 1,500, what percentage of those children live in properties that are essentially non-compliant with the lead safe law? Do we have those data?
Let me put it another way, because I don't think I can answer your question exactly, but one of the things I didn't say that I neglected to say that we announced on Friday was that we do know of 11 cases of greater than 10 micrograms per deciliter level where we then went out, investigated the home, found a source of lead poisoning. Those 11 cases happened in homes that we had given a lead-safe certificate because they had passed the clearance exam. And so in some cases, just a few weeks after they passed a clearance exam, they poisoned a kid. But of all these poisonings, what % are happening in lead safe versus not safe? I mean, most presumably are happening in non-compliant properties, just based on, what we know of compliance with the current law.
Sure, and I think like all of my questions are sort of data-driven.
Good.
Can you kind of speak broadly to the ability for building and housing and health to collaborate on data with HIPAA being sort of an elephant in the room? Is there an easy way for us to determine that this occurred at a property that is not compliant and be able to pass that information over to building and housing for enforcement, or does that create its own privacy issues?
There's a way to do it, and so there are absolutely privacy issues in terms of like anytime we get a result of a kid who has lead poisoning, that is a health condition, and so we don't disclose any personal identifying information to anybody who's outside the loop. But Building and Housing now is sending us their list of addresses that are lead safe certificates. We can look at it with our lists of properties that we're investigating doing the lead poisoning. So that collaboration is now happening.
Okay, and specifically around the non-compliant properties, that's where I think that's not, obviously it's already happened. We are trying to prevent it from happening in the first place, but I think that I am of the opinion that we should not be shy to go after property owners who created the situation in the first place. So you're saying that conversation is underway, and that there are mechanisms, hopefully, that are being developed that we can address use this as a way to identify properties that are not compliant with the lead safe law.
Well, through the chair, there are two things there. So there's one, if a child has been poisoned in a property, the health department goes after them, and we prosecute them with the Department of Law. And so we've been doing that more aggressively over the last couple of years than we have in the past, and that has led to results in that more properties are coming under compliance, meaning they're abating the problem. That doesn't necessarily help those kids, though, who have already been poisoned.
Sure.
Right? And so the other part of that is, you're right, we have a general sense of properties that we think will poison a kid. We did a property survey across the city, and we know which ones are C, D, and F. And so that is part of what we're proposing, and Director Martin O'Toole will speak to that, of like, if we see peeling paint from the street, we know that could potentially poison a kid, and we should use our enforcement powers to intervene.
Thank you. So I'll put a pin in that, and knowing that Director O'Toole is going to come up and also share some perspectives. So the first, I wonder about this in any number of things we talk about, whether it's this or even voter turnout, or but when you go to the initial slide, yes, reading my mind.
Yeah.
The city's population, we know, has declined since 2005. And one of the things, and that don't answer, this is an impossible thing to answer, but it's essentially to the degree that there are populations that are vulnerable and or not testing at higher rates, is it that we are achieving more testing, or is it that people who are more inclined to have kids tested have left the city, and there continues to be this, essentially, does the city of Cleveland have a hyper concentration of harder to reach populations compared to peer cities or other, that really the crux of this, is this something to celebrate, or does this chart underscore that we have this kind of entrenched challenge that we're trying to meet?
Through the chair, yes. So our theory, looking at this run chart of improved lead poisoning rate over the last 20 years, is that with population loss from 2005 to 2015, people were more likely to abandon those homes that were most likely to poison children. Those homes were demolished at a very high rate between 2007 and 2014. And at the time, we were losing population, so losing those homes did not cause as much housing insecurity as now what's happening, where our population has stabilized, where losing any home means someone else without a home. And so we can't just demolish our way out of this problem unless we have a equal focus on building new, safe, affordable homes. But we think that is what explains this huge drop in those years.
Okay, thank you for that. And then my last question, could you flip forward 2 slides? When I've asked in the past, I guess the first initial question, are there data on what percentage of children in Cleveland, say 5 and under, are getting like an annual checkup, going in for like routine annual flu shot, getting your just wellness visits essentially? Are there data that speak to that in the city of Cleveland?
Through the chair, the data isn't perfect around that, so we have proxy measures. Honestly, lead testing can be a proxy measure for that. Child vaccination rates can be a proxy for that. But the denominator, how many kids live in each neighborhood, is based off of estimates that aren't perfect and fluctuate. And so that is something that we would like to get better at with help from our colleagues from Dr. Fisher, from CASE, other partners in Cleveland that have all the healthcare access data that can really help us. So this is an approximation of what's going on now.
So do the data suggest that essentially that this is a map of lead testing, but is this also a map of just wellness visits? Our children, because I ask because when I've asked this in the past, there are those who have said that's not really the challenge, and I guess we know from the disinvestment and redlining and also how communities of color have been treated by the medical profession in the past, that there are populations that are reluctant to go to the doctor. And I was talking about this last week on a tour of Central,
Yeah.
and I've kind of said to people who have said that children's wellness visits isn't an issue, that it sort of bucks reality that children living in a community where people are reluctant to seek health care or have hurdles to getting to health care, that's not affecting their children, and that we have communities where a parent might not be able to take off work to take a kid to a doctor on a Tuesday, and that this compounds, and what do we need to be doing just to improve access to primary health care in these communities, and lead testing would be a beneficiary of just that larger macro focus.
Through the chair, you got it. That is a huge challenge that partly explains what we're seeing here, that children just do not have access to pediatric wellness care in general. The other factor, though, is there are some 1-year-olds, 2-year-olds who are going to appointments and leaving those appointments without the test. The reasons for that is maybe the doctor did not order the test, or maybe the doctor ordered the test, but they don't have a phlebotomist who is experienced enough to get blood from a 1-year-old, which we all know is very complicated, very hard to do. So those are the challenges that we're looking at, and the Lead Safe Coalition, as they'll announce later in their slides, are putting out an RFQ this week to help fund a partner to help improve that and close those gaps.
Okay. I'm interested in us exploring just at a broader level on this committee how we can be pushing our healthcare providers to increase access, but also how we can be improving our communication to our residents about why we need to seek wellness visits and what we need to be doing to maybe minimize the obstacles like having to take time off work and things like this. This seems like the big issue, and I will simultaneously acknowledge that if there are vulnerable populations that I probably am not on that list. However, to my knowledge, neither of my children have ever had more than a finger prick test. I did not receive from the hospital for either of my children information about lead when my children were born from 2 hospitals. So I do have just questions. If the information is not being provided to me, I start to question if the information, is it not being provided to me because of an intentional decision, or are we still having challenges of getting this information out to all residents of the city of Cleveland?
Yeah, through the chair, as a primary care physician by training, you're speaking my language. This is an issue, access to primary care, that we need to work on, and we would love city council's help with that and putting pressure on our health partner colleagues to fund more primary care. Where you live, you've got one of the higher testing rates, so I suspect your kids were tested, but We do know at least one pattern that Cleveland residents, when they go and see a primary care provider outside of Cleveland, are less likely to be offered lead testing compared to Cleveland residents who see a provider within Cleveland. And so that is part of the work that this partner through the RFQ process will help us to close that gap.
I'll put a pin in it for now.
Thank you, Councilman. I know this is, haven't gotten to reflect yet on how troubling this data is, and of course we were talking about it, and I released a statement on Friday. I just want to prepare for the panel a little bit of the sort of course of the day that we're hearing about the data brief now. We're then going to go to a longer discussion of the City of Cleveland's different departments and implementation of aspects of the Lead Safe Certificate program. And then after that, we'll have the Lead Safe Cleveland Coalition here to present the private side of this public-private partnership. So I just want to clear that for everyone, that there might be questions that will come later on, and we're going to have a lot to get through today. So we're in it for the long haul is what I'm saying. I have Councilman Harsh on the list next, and then Councilwoman Gray.
Madam Chairwoman, can you put me on, please?
Thank you, Madam Chair. I'll try to just stick to the presentation at hand, and we'll do them one at a time. But through the chair, when I got my lead risk assessment license back in 2006, I believe the standard for poisoning then was 10 micrograms per deciliter, and it since was lowered to 5 micrograms per deciliter. Pursuant to the first slide on here, through the chair to the director, is the official standard now 3.5 micrograms per deciliter, or is that a choice on your department's behalf?
Through the chair, the CDC and Ohio Department of Health have updated their recommendations to look at this 3.5 and above level. However, Ohio Department of Health and I believe HUD and maybe the CDC still have the definition of poisoning at greater than 10, but we know there is no safe level, and so that's why we're looking at this lower threshold of 3.5.
Absolutely, through the chair, I don't want to diminish there's not supposed to be any lead in
Right.
anyone for any reason, even though it's a element on the periodic table. It's not like magnesium or copper that you don't put this in vitamins. We're not supposed to have any amount of it. And so any lead is too much lead. But I am asking because we are looking at historical data where we are tracking lead levels in children, and we have changed the standard of measurement over the years. And when we change standards of measurement, our historical data becomes skewed. So in this first slide where you show 50% over 50% in 2005, over 3.5 micrograms per deciliter, I believe that sounds about right, tracks with the information I have. And now we're down to, it looks like 18, 19%, but still not anywhere near the 0% we're aiming for. And on the next slide with the different cities, this uses the 5 micrograms per deciliter standard that we're a little bit more used to seeing when we look at graphs showing percentages of lead poisoning. This puts Cleveland at 11% or whatever that is, Toledo and Detroit down there at 6. And this is a little more in line with, I think, a lot of the graphs that people are used to seeing. So the first thing I just want to point out, Madam Chair, is that the difference between the two graphs is the difference between 5 micrograms and 3.5, and it's a different measurement standard. Because I guess my question is, through the chair to the director, what percentage of children in Cleveland under 5 do we have lead numbers for? I see that we're coming up on slides where we talk about the number of children tested, but
Yeah.
east to west, north to south, lake to 480 or whatever.
Sure.
What percentage of all of Cleveland children do we have a lead number for?
Through the chair, so that's what this map shows in the last year, children who are under 6 being tested, having at least one test. And so it depends on the year, the demographic, the neighborhood.
And through the chair, there can be different densities of children under 5 in different neighborhoods.
Yep.
So I guess my question is, do we know what percentage of children under 5 have been tested?
Through the chair, we do from this based on
Citywide,
census
total
estimates.
one number for the whole city.
Yeah, so I just broke it down. We have it broken down by neighborhoods, so I can report back what the number for the city denominator is.
And what I'm getting at through the chair to the director is that number going up or down over time? Are we testing more kids than we used to? Are we testing the same number of kids as we used to? Or was there a spike in testing and we're now on the decline?
Yeah, no, thank you for that. Sorry, I didn't catch what you were asking.
Sure.
So through the chair, I'm going to put it to you this way. In 2019, there were 11,000 tests done on unique children in the city of Cleveland under the
Okay.
age of 6.
11,000.
11,000. In
Okay.
2020, it was about 8,000. Okay, 2020, COVID, remember that? So we had, legitimate reasons for downward access. 2021, about 8,000. 2022, about 8,000.
Okay.
2023, about 8,000 tests.
Okay.
And so we have not rebounded in
Okay.
terms of and we've seen the same thing with absenteeism, with child vaccination rates. And so we think, to Councilman Slife's point earlier, that folks were lost from the system, essentially, unable to gain access or, resume relationships with the system, and that hasn't rebounded. And so that's a huge problem.
Okay. So through the chair, we know that about 8,000 children were tested last year. We don't know how many total children under, and through the chair, I guess this is just a statement, it's very difficult for us to know how many children under 5 are in the city because we can use school enrollment data for children 5, 6, and 7 once they start to enroll, but all we have is birth records from area hospitals. We don't know how many of those kids live in the...
Through the chair, we have census data, so it's about 24,000 is the estimate.
Is an estimate, but if we know that we're testing 8,000, we don't know if that's of 24 or 22 or 25. We don't really know exactly how the number moves on a hard number in between years. We have estimates.
So through the chair, I know we're going to spend so much, we can move on after this, but
Yeah.
Councilman Slife wanted a point once you're done.
so 24,000 kids who are 1 through 5 or under the age of 6.
Sure.
And the recommendation for children in Cleveland is they are tested at age 1 and 2, or less than 6 if they have not yet been tested at 1 and 2, or continue to be tested if they were positive in the past. And so it wouldn't be the expectation that all 24,000 of the 1 to 5-year-old children are tested. And so that's where it gets a little murky. And so
Yeah.
for me, I think the takeaway on where our testing is 11,000 in 2019, 8,000 every year after that. We have not rebounded.
But through the chair, and then I'll yield for a point. Through the chair, we ought to have the expectation that 100% of children are tested for
That's
lead.
right.
Through the chair.
That ought to be our expectation.
Through the chair, every 100% of 1 and 2-year-olds, it needs to be tested. What we're looking at as a denominator is under 6-year-olds. So a 4-year-old who tested negative when they were 1, negative when they were 2, should not have another test at age 4.
However, through the chair, we can safely assert that if the percentage of children under the age of 5 is 8,000 out of 24,000, we know that the number of 1 and 2-year-olds tested is not higher because they would have been included in the larger sample. My point is this: at best, Madam Chair, we're testing 8,000 kids in a city of 24,000, and we ought to expect 100% of 1 and 2-year-olds be tested. We ought to expect that 100% of children get a lead test so that we can have a pure, accurate number of how big is the problem, how widespread is the problem, where is the problem, and all that ought to be available to us if we were testing 100% of the kids, and we're not. And Madam Chair, I'm going to bring this up many, many times. The lead tests should be available for every single child in Cleveland, in Ohio, based on their health care program. And all children under a certain economic threshold have health care in this state on one program or another. Care Source is just a really common one. And we're going to come back to this because I don't want to be inaccurate with data, and I don't want to put rose-colored glasses on data. But I also know that Cleveland loves to be negative, and we love to beat up on ourselves. And sometimes we like to beat up on ourselves because we're being honest about ourselves. And I think that we could be walking into a problem where we don't have full data on how bad the problem is, but we're changing our standards of what is acceptable. And so it's looking like a spike, and maybe it's not. And I think to Councilman Slife's point, and I apologize, I will give you the mic in a second, who's moving out, who's not moving out, what houses are being demolished is a great, wonderful point that we have to take into consideration. Is the problem getting worse? There's obviously more to do, but this is where I want to go back to. So I'll yield for a moment if the councilman had a point. And I just have one more question on this slide.
Through the chair, just to respond to that, I agree, we don't know the whole scope of the problem, but what we do know is for the last 3 years, every year, nearly 1,500 kids have been poisoned
Okay.
in the city of Cleveland. And so,
Or more.
right, that
Because
we
we're not
know
testing
about.
them.
And so that's why we're sounding the alarm. 11 kids were poisoned in lead-safe certificate homes, units that we know about. But 1,500 kids with no improvement. That's why we're here today, working together to figure out what is it going to take to see a reduction in the number of children poisoned by lead in 2025.
Did you have a?
I sort of wanted to ask the inverse of Councilman Harsh's question. If 1 in 3 residents of my neighborhood, or 1 in 3 children have been tested, if I called the Cleveland Department of Public Health and gave my children's name, would you be able to confirm whether or not they've been tested, or are you just receiving kind of raw data from providers?
You're asking a HIPAA question. That's,
Yeah, well, it's your data, right? Yeah.
Okay.
Through the chair, certainly I could, certainly you'd be able to call your own healthcare provider to.
Well,
your
and
children's
of
healthcare
course,
provider.
and I ask because, and this is again, an idea that might not be practical, but there's a birth certificate downstairs with my children's name on it, with my name on it. You know where I live. I'm registered to vote. So if you're receiving names from, it just seems like there's a way to kind of back into, in theory, that, hey, we know there's a child living at this address because they're listed on this birth certificate and their parents still own the house, but we don't have their name having received anything from a healthcare provider. So do we need to send out something to this household that says, hey, we have a feeling that has your kid gotten lead tested? Did they not send it to us? Are you aware of this? That it could almost be part of the campaign. But that's only possible if we're receiving kind of the John Smith's name from the healthcare provider, and not that we did 10 tests this week and 0 of them were positive, so you just have a raw number. So that's kind of the onus of the question.
Yes, well, through the chair and my team has confirmed, yes, we have the names of everybody who's been tested. Yes, we have our birth certificates. Birth certificates don't necessarily indicate where a child ends up a couple years later or a year later. But absolutely, to your point, all of your points, we can all be doing a better job. And it starts with us, the health department, of improving our screening rates in the city of Cleveland. I think I just want to caution us to say we need more data on how much lead poisoning is happening in Cleveland. We have a lot of data that shows lead poisoning in Cleveland is very, very bad.
Let me end with this, Madam Chair, if I
Yeah,
could,
thank
and
you.
I apologize, but this is just, I want to try to get into this. Madam Chair, I believe that every healthcare provider is required to offer lead testing or screening to every parent, every child in the state. I believe they are required to offer it. Madam Chair, I do not believe every parent is required to take up that offer. And I think that this is part of our problem. I think people are able to decline the test, they're able to decline the data, and we in turn don't find out what the true numbers are. And I wonder if this is a problem that we can solve at this table. I don't know if we can solve that specific problem. We're going to solve every problem we can at this table. But if there are people refusing lead tests for their children, not getting lead tests for their children, that is going to be a problem for our city because it gives us incomplete data to understand what where we're trying to deal with the problem, where we're putting our efforts, and it also gives us misleading information about the problem at hand.
Through the chair, I'm going to push back strongly on that. And I'm going to remind you that for those kids that we're testing that have that level, how are you helping them? How are we helping them as a
That's
community,
right.
as the city of Cleveland? And so, in a lot of cases, we're evicting these families when they test positive. So we need to do a lot better job of taking care of the 1,500 families that we already know about before we say that every family is doing something wrong and not going out of their
I don't
way to
understand what
test
the
their
push
kid.
is through the chair to the director. If there are an estimated 16,000 people not testing their children for lead in the city of Cleveland, we need to get those 16,000 children tested.
If I may,
It's their health we're
no,
worried
absolutely
about.
contribute to the conversation. I think there one question is a mandate, what's mandated for families versus what healthcare providers are able to do. So much, Director Margolius runs the Screening and Testing Commission, which I strongly encourage any member of council and any member of the public to participate in. And having participated in it, the number one thing I've learned is that so much of the fall off of testing comes from friction within the healthcare system. That there's not a phlebotomist on hand who can do the draw for a 1-year-old, that you have to go down the hall or even make a separate appointment for a family that already struggled to get to the first appointment. And what we know from the data that Better Health Partnership and Cleveland Department of Public Health have put together is that there are pediatric providers who are excellent at getting their families to test. They have 90% plus testing rates. And then there are providers that are terrible within Cleveland and within the suburbs at getting their families to test. And so I think that it gets to the point of a medical ethics question around the mandate, something that is beyond what this table can do, but there is a lot of work we can do as a city to talk with our providers about how they get to the point of testing.
Right. We can't solve a problem if we don't know how big it is.
Through the chair, we did a housing survey last year led by Director Martin O'Toole's team. We know how big the problem is. We know how many C, D, and F properties we have in the city of Cleveland. Let's start fixing the problem there instead of waiting for the kids to test positive.
We also know through the chair that exterior A's and B's can also have problems inside.
Yeah.
Exactly.
Yeah.
Right.
Exactly.
So
let's
we use the data we have. We don't have all the
through the
data.
chair. Let's use the homes and not the kids as canaries. I mean, that's what we're saying here.
Yeah.
Oh,
We've
for
already
sure, for
got
sure.
1,500 kids who are testing positive. We already know the problem is widespread. Let's focus on solutions and fixing those homes.
Right.
Thank you. If I believe I have, Councilman Harsh, are you
Yeah,
done?
that was it for this.
I'll take one moment of the chair's prerogative to, I think, sum up, this conversation, which is that we know what we're saying today is that we have a very big problem, and we don't know yet if we have a very, very, very big problem, but the question of tackling our problem, we should not be dismissing that in and of itself. So Councilwoman Gray, I'll yield to you.
Thank you, Chair. I just have a couple questions. I just want to just tailgate on Harsh questions, not Harsh, well, Dr. McGolish, about the 11 kids that you said that was tested. Do you know what area, per se, of those 11 kids where they have the problem?
So through the chair, 1,500 kids testing positive across the city.
Across the
What
city.
we're talking about is 11 children who had an address of a rental property or property that was given a lead-safe certificate that subsequently tested at greater than 10. Subsequently, health inspectors went into their property and found a source of lead poisoning. And so those 11 are scattered across the city from a wide array of different inspectors, private inspectors.
Okay, so is there data on that? Is they spread from the east to the west, north to the south? Is there data on that per se? Is that HIPAA? And/or is that something that we can see where those 11 kids got the...
Through the chair, the exact addresses?
Not the exact addresses,
Yeah.
just in the areas per se.
Well, through the chair, so this is where the dots are representing children being poisoned who are testing positive for lead poisoning in the city of Cleveland at 3.5 and above. And so you'll see your ward is absolutely represented in there.
Yeah.
To Councilman Harsh's point, there would be more dots there if there was more children being tested in that neighborhood or having access to care or getting offered that test at their appointments.
Okay, and Chair, to the Director, I know this is a hard, you don't have all the answers to the question, but just to say, like I said, I've been out here with, once again, with Kim Foreman and her partners since 2019. So we were in Glenville, Clark Fulton, Buckeye, my area, before I became council. So I was out there with them with this research that you have here.
Yeah.
And I do understand that, but to the point of that, the east side is still getting is still not getting tested as much as the west side.
Correct.
Do you have an answer to that, Chair, to the Director?
Through the chair, do I have an answer to why the east side's
It's still
testing rates are
a
not as high
lower-
as the
yes,
west
that's
side?
right. Mhm.
Well, it goes back to structural racism, leading to racial wealth gaps, segregation, neighborhoods that have been concentrated level of poverty due to redlining, and lack of trust within the healthcare system, earned trust because of decades of wrongs by healthcare partners on residents of our communities. So it's multifactorial, but it all goes back to institutional structural racism, absolutely.
Okay, and I can agree with that, because my question, I know you probably have, since you are the health director, how closely, Chair to the Director, how closely are you working with the doctors, the providers in all the hospitals that are number one, Cleveland Clinic, University, Metro? Tell me how closely you're working with their data to try to understand why our children are not being closely tested with the lab testing, whereas they should be at birth,
Right.
per se. Why is this, Chair to the Director?
So to the chair, I'm working closely with those healthcare partners to increase testing rates. The RFQ that Lead Safe Coalition will discuss will help to fund an organization to use all the healthcare data to see where those gaps are. If it is, as Councilwoman Moore has pointed out, if it's mostly folks coming to appointments and just not being offered at that moment the test. But again, the scarier outcome than the lack of testing, or equally scary, however you want to frame it, is all of these kids who are testing positive in our neighborhoods, east side and west side. That's where we got to focus on prevention, because if the kids get tested and they're positive, much damage has been done. We can prevent further damage for those children and their siblings, but the onus is on all of us to prevent it, so that the Cleveland Department of Public Health no longer has a lead poisoning team, because our team is dedicated to following up each of these cases and ensuring that we're going into the homes for certain cases and getting in touch with all these families. But there are cities that have a really small lead poisoning program because they don't have a lot of lead poisoning, and so that's what we need
That's
to
what
do
we're dealing with.
to get there, and
Yes,
that's what we're talking about today.
And I do agree with that, because only reason, Chair to the Director, I asked that question because when I was out there with the resource-led team, we had Case West Reserve, we had the state. We had all different type of partners, to say the least, at the table when I was out there with them between 2019 and since I came council, I had to kind of step away from that. But I know that the partners are still out there doing what need to be done.
That's right.
So just to say, as my colleague Joe Jones, Councilman Joe Jones said, that he was at the table 30 years ago, and we still here today. So this is not like something new per se, but I know for the families that, children that have not been tested for lead, that's something that we become naive to, because our children are fine. But the children that has been tested with lead, that's something that we have to better understand how to assist with those families, to understand why we still have so many children are, tested with lead per se. But to say the least, that is a long conversation, because we're still here at the table in 2024, still talking about what happened 30 years ago when I was part of the process in 2019. Now it's 2024. So yes, we all have to stay involved and figure out how we can connect the dots with all the providers to assist with this situation. So I have one more question for our Director of Housing, Sally Martin. Yes, the question is, Chair to Director, when Dr. McGoyan stated that 167,000 partials was evaluated a couple years ago, I think he did an excellent job, and that really brought a lot of this to the surface. What now has been done with those houses that still that still are in deplorable condition and have not been cited, with children in those houses today? What has been done up to this point, Chair, to the Director?
Through the chair, we've begun systematic enforcement on the southeast side of Cleveland, starting with those metrics, but we're also back following up on those properties as well. We don't know which properties have children in them, but we have been following up.
Okay, so Chair, that's a good answer, and that's a good, honest answer. So Chair, to the Director, just to follow up on that, that is so true. Because as myself being council boots on the ground, and I'm glad that this came up because I was out in my community yesterday, and there were several houses that I walked through my neighborhood with children in them, and the houses are deplorable. They are absolutely deplorable with these slum landlords that's in our community housing these families that's living in these houses that should be tore down, and they're not rehabable. Some need to be, and I understand that process. But for what I ran into yesterday was deplorable. And I ran into a homeowner, a landlord, that asked me specifically not to cite him for his deplorable house because he did not want to be known and to be put in the system to be cited. But I told him, too late. I will call on this house. You will be cited. He's planning on rehabbing it, and it's not rehabable. It is not, because it's a flipper. It's been flipped 3 times. So just say that's a great question. That's why I'm bringing this to the point. What you're doing is excellent, I say, and I know you have a lot to. Research throughout Cuyahoga County, but that I think a little bit more aggressiveness need to be done on these deplorable houses that we run into, that they need to be cited as the Resident First Amendment we passed. That needs to be looked at more to connect the dots with our children living in these deplorable houses. And I understand the financial situation of some of the families that's on the Section 8 voucher. They are being taken advantage of because they don't have any place else to go, and they living in these houses, that should be boarded up. So maybe, I don't know what I can do with you or somebody in your staff. I can give you a list of them that I took down yesterday. So they need to be, because I already checked up on them and nothing has been reported in per se because the families need places to stay. But these landlords need to be accountable and brought into housings and appeals and make them renovate or repair the condition of these houses, that these kids, I already know that's going to be affected with lead in those houses. So I wanted to just share that with you. I know that you're doing a great job and stuff, but we need to be more involved in this situation. So I yield, Chair. Thank you.
Thank you very much, Councilwoman. I believe I have Councilman Joe Jones on the list, and then we'll move to the full presentation from the City Building and Housing and Community Development.
Thank you, Madam Chairwoman. Listening to the conversation and looking at the screens, and I just want to take the time to thank the director for, and my colleague, Mrs. Gray, for her presentation and asking the question where the director talked about the reasons why we have a major issue, especially on the east side with lead poisoning, is because of the redlining that has been going on in our communities, the destruction of a number of homes. If you look on the east side and you compare the east side to the west side, it's night and day. You can just go in your car and see that. You can see the investments and the developments that are happening on the west side of town, and you can see the lack of developments and investments even now on the east side of the city of Cleveland. You can see, Madam Chairwoman, the disparities between the west side and the east side is so obvious in your face. And so I've been sitting here and I've watched one administration from the next administration, one council president to the next council president, and we really fundamentally as a city have not addressed this issue fundamentally. And we've sat here across this table and we've kicked the can down the line. Now we've set up all of these funds to have these different folks do things, and yet we sit here today and really, I'm not sure. I'm gonna wait, and hear the other testimonies of what's going to be said and presented. But what I've heard so far right now, I'm not totally impressed. So what I will say, Mr. Chairwoman, as relates to lead poisoning, I think if the administration would take these suggestions, a lot of people don't know because we haven't communicated the damage and the seriousness of lead poisoning from one generation to the next generation and so on, et cetera. And so I lead to ask this question to the health director before I move into what I would suggest. What are we doing to educate people on, in the city of Cleveland, why it's so important to test? And what are those, what does lead poisoning do to a human being?
Through the chair, thank you, Councilman, and just acknowledge the decades that you've been working on this and everything you've said about the different administrations going from one to the next with it still being a problem. I just do want to acknowledge, though, this is not and I know you're not saying this, but this is not a council versus administration problem. I was at a presentation recently where someone gave a talk on this topic, and someone from the audience said, well, you're saying it's structural racism and that these are the things that you need to do, but 3 of the last 4 mayors of the city of Cleveland have been black Democrats, and so why haven't you fixed it? And you could tell where he was going, right? I mean, it just awful things that people feel comfortable saying, and I know you're not saying that.
Madam
So this is
Chairwoman,
very
to the director, I want to get on to the point because I know you like the doctor of everything. So we're sitting here, we know, I know that it's racism. And whether who's sitting in the chair or not, there still should be held some accountability. Whether it is a white mayor or a black council president or a white council president and a black mayor, or the members who sit here on this body are also should be held accountable to their inaction on the issue. So now we're here. My question, Madam Chairwoman, to the distinguished gentleman was how do we communicate and educate our public on the seriousness of lead poisoning?
Can I ask you a question, council member, through the chair? Can I ask a question?
You're the councilman.
I'm sitting back watching you and chairing, which is good. You're doing a good job chairing. I always look at, for me, I'm not going to sling and say anyone is a racist or whatever the case may be. This is for me. I'll ask this man, Councilmember Joe Jones, what can I do to help? And I'm not going to say someone, then once I'm if I'm in that paradigm, then you see what I'm saying?
Yep.
So I would never ever, when I call you up, I ask you, and I just don't say black or
Well,
white.
Mr. Chairman.
Let me say this, and I'm going to yield to you. I'm in leadership, and you're in leadership also, so as we plural, what are we going to do? And that's just where I'm at.
Mr. Chairman, the gentleman stated, brought up the issue of who were in office and the black people who were in office and all that. I didn't say that. I asked him a question, Mr. Chairman, and the question was a question of how do we educate our people in our community, the seriousness of the effects of lead poisoning, and that was the question. Now, the distinguished director came in and started talking about leadership in blacks who represent, because he went to some other kind of meeting about that. That came from him. So, but you, Mr. Chairman, you have, you know, as the chairman, you can ask him whatever questions you have that you would like to ask him. So, with all due respect, Mr. Chairman, I've asked him some questions, and I was looking for the answer to that.
Through the chair, so you started off just in terms of administration versus council. I want to make it clear.
No.
I want to make
no.
it clear. We are in this together.
No. Let me
I'll
make
stop.
sure. No. Let me
You know what I'm saying.
restate the situation so you can understand the
Thank you.
frustration, because that's the reason why we're sitting here today.
Okay.
Is because people don't take this serious.
All right, great.
There's no passion here. Out of sight, out of mind. I opened up my production, Mr. Chairman, to the director to talk about this has been an issue sitting here at least 30-some years. Yeah. Now, we can shake our heads because it's not happening to you when all of a sudden the little young lady who's 10 years old who has hypertension and then has a heart attack. Oh, so bad she has a heart attack. Oh, she was such a good child. God bless her soul. She's gone. Or talk about the people who are having kidney problems and reproduction issues in the African American community. Oh, maybe it was something you ate. So when we start talking about the immune system and the impact and the health problems that are happening inside the African American communities, when you can look in my neighborhood and see a huge difference and the difference in terms of health, the health care, and how people are dying more in the African American community, and they only live 2 or 3 miles away from other affluent communities that are living a lot longer. So, Mr. Chairman, to the director, the question is an easy one. Is how do we educate people about the seriousness of lead poisoning and how it's impacting their health? What are we doing to talk about that? Because we have issues of high rates of heart attacks in the African American community. We have high rates of people in the African American community with high blood pressure. I'm one of them that sit here at this table. So that's and I'm not trying to have any conflict with Mr. Chairman, with the director. I just want to know what we're doing here to educate, and then I'm gonna lay down what I think.
Okay. Okay. Through the chair, yeah. And listen, I took it in a direction, but my point is, we are, in order for us to do a better job of getting the word out, we got to focus on who the enemy is and where the problem is coming from, and that is lead paint. We go to countless outreach events across the community. Lead Safe Coalition has run a wonderful marketing campaign that you can see all over the city of billboards talking about getting tested, getting your homes tested, getting the resources out there. We've got lots of news. But at the end of the day, when I go to community meetings to talk about lead poisoning, I have residents who come up to me and say, "Don't worry, I'm good. I got my bottled water." And why do they say that? They say that because the story of Flint, Michigan has just carried the attention of folks who live in Cleveland and across the country much more than the story of lead paint poisoning in Cleveland. And why is that? Why do we think that is? Water, we all drink water, right? We all drink water.
Mr. Chairman, I'd like to rescind my time.
Okay.
I asked a question, Mr. Chairman, and the question was straightforward. What are we doing as a city to talk about the dangers of lead poisoning? And I would have hoped that I would have heard the director say, well, we put out a pamphlet that talks about, number one, it impacts the nervous system. Lead exposure can cause significant damage to the nervous system. 2, cardiovascular system. Lead poison is associated with the increase of blood pressure and a higher risk of hypertension and heart attack disease. Number 3, we put a pamphlet out that talked about kidneys. Prolonged exposure to lead can damage the kidneys, leading to decreased kidney function and increased risk of kidney disease. I would have liked to hear that you would say that the reason why we have such a big impact and in some areas in the city, like third world countries, where women are having miscarriages at a rate that we have never seen. You talk about the impacts of the reproduction system. That's what I was trying to get out of you. What are, and it's a straight question, because I don't want to stay on this issue, because I want to move to another one. Do we have pamphlets and information out there educating the citizens of the city of Cleveland on the dangers of lead exposure?
Through the chair, we do. We have billboards, we do pamphlets, we go to community events. My point is that we're not doing enough, all of us.
So when we're doing that, do we have ways and means, Mr. Chairman, to maybe send pamphlets to every house, Director?
Through the chair, I think we do have that ability. We certainly send them to high-risk households, and we could absolutely do a better job of that. I think that we really need to think bigger, and that's my point. Because, again, folks in Cleveland are still more focused on their water than what we know is the cause of lead poisoning in Cleveland, which is those paint
So let me ask this, because
chips.
you keep talking about water.
Yep.
So do we have lead poisoning in the city of Cleveland's water system?
Through the chair, we do not. That is my point.
Okay, so now we got that off the table. So now, Mr. Chairman, to the director, let me just say this so we're on the same page. This administration that you are a part of, I think is doing more as it relates, and this council, to deal with lead poisoning than previous councils. So I don't want you to think that in any way that I'm suggesting at the table that we're derelict in our responsibilities and duties. That's the reason why we have this meeting here today. So that's not what I'm saying. What I'm saying is that the can has been kicked, and I don't want this to be a stuttering point where we don't move a little bit more aggressive.
Agreed.
So if I would make this recommendation, Madam Chairwoman, and to the chairman, there are several cities, Mr. Conwell, that has implemented mandatory lead testing. And that's what we started out this conversation this morning, about how do we have mandatory lead testing in young people. And we see that New York City requires lead testing for children under the age of 6 and has strict regulations for lead in housing. I know that we're putting our program together, but these are some cities that we can certainly look at and see what's best practices. We see Chicago, Illinois mandates lead screening for children and has regulations in place for lead paint in homes. We can also look at the example in California, where they have programs for lead testing in children and initiatives to reduce lead exposure in housing. So my suggestion, Mr. Chairman, let's not talk about how we create a wheel. The wheel is already there. Let's look at these cities and see what they're doing in terms of best practices. And that would be something I would ask, Mr. Chairman, to the director and the administration to look at, what we can look at that has impact, that can create the type of change that we need to have in our city. And really look at, if they have mandatory testing in those cities, why can't we? Because you won't know what the problem is unless you have mandatory testing. So, Mr. Chairman, my suggestion is we, as a council, instead of us sitting here, another group of folks sitting here, 30 years from now, talking about the same issue, because that's where we've been, and that's where you see the frustration. So when you see the passion, Mr. Chairman, to the director and to the administration, that's because I live in it. I live in the heart of the African-American community. I grew up in different parts of the city of Cleveland. I'm thankful that I have an opportunity to still be here with you. But I do have, like many Clevelanders, hypertension issues. Heart attack is the leading cause of death in the city. All of that's due to lead poisoning in these homes. So, Mr. Chairman, can we talk to our staff and talk about taking a look, and I encourage the administration to take a look at New York's example of mandatory testing, as well as mandatory testing in Chicago. Let's look at their legislation. We can work together in partnership. We can pass something that makes sure that every kid in the city of Cleveland is tested for lead. And once we find out where they're tested, and if they're tested positive for lead, then we can home in on the issue and deal with it. But we cannot technically, clinically get in here and really fundamentally deal with this position, or this issue rather, Mr. Chairman, unless we're doing testing and everybody's being tested. And Mr. Chairman, to the director, what are your thoughts on that?
To the chair.
Through the chair, my concern is that, in each of those cities that you named that were best examples, you said mandatory testing for kids and more stringent requirements on the homes those kids live in. That's how we prevent the lead poisoning. And so we cannot get out of this problem by waiting for kids to test positive for lead poisoning. We got to be proactive. We got to go upstream. We've got to make more safe, affordable housing available. We've got to help homes become lead safe. We've got to help homes become lead free in order that so that Cleveland kids can grow up in a place where when they get that test, it's zero. So I'm just worried that if we're waiting for more data on more kids being tested who are positive, then we miss our chance.
No, no,
So let me
Mr.
ask him a
Chairman,
question.
Mr.
And I
Chairman.
agree with you, I agree with you. He has a point. Look at New York, look at Detroit, even go up the street, you and I can drive to Akron and look at lessons learned. And I don't know what they're doing, but if they have some policy, and policy would not, it can't just be policy. You got to execute on things. And a lot of our problems, it might not even be bad legislation, it's the execution to make sure things are happening. You can put it on paper, Councilman. We have a lot of laws, a lot of ordinance, a lot of rules, but if people are not working and you're not monitoring and controlling what's going on, and then you execute from when you see something deviate from the work, and you make sure that it got to be a culture. And it has to be a culture of executing, because it can't just be policy, Mr. Council Member. They got to work, man.
Well, Mr. Chairman, what I'm suggesting is not an issue of either or. I mean, we're big government. It's like if we are just picking at one area, we should have various tools at our hand. This is an issue that has been here with us. It has had a huge impact on the health of the African American community.
Right.
As you see, I've outlined all of the various different health problems that can be caused by having lead poisoning and being exposed to lead poisoning, and how it shortens a human being's life. And one of the sure ways that we know that someone has been damaged is we've been talking about testing. And it seems like, Mr. Chairman, every time I talk about testing, not just here, but when we initially started talking about testing, when we had the lead poisoning issue, it was like, oh no, we can't have a mandatory testing of all our clinics here. It's no way, and it's all impossible. It was all of this, that, and the other. But, Mr. Chairman, I've done my research. And in my research, Mr. Chairman, it's clearly other cities have mandated mandatory testing. They have systems in place so that when those children are exposed, Mr. Chairman, to lead, then that information is gathered by the city, and the city is moved into making a difference
Would you like
in terms
to
of
do
having
when you
impact.
finish?
On that
And-
point, Mr. Chair?
Right.
Point, and then we got to put you back
Well,
on.
well, let me just say this, because I'm going to finish up, and you don't have to put me back on.
All right.
It's real simple. Let's look at those cities that have those best practices. It's
Lessons
only,
learned.
Mr. Chairman, it's only a tool. I don't think that any one of us are the experts here, right? So, but whatever tools we can put in our toolbox to prevent lead poisoning to continue to happen in our city from one generation to the next generation, Mr. Chairman, to the director, to the administration, yeah, we're working together. But let's see how we can get mandatory testing like other cities in this city so that we can start truly saving lives, identifying those properties that have a major issue, and then working in the process to resolve that situation.
That's the conclusion. Do you know what? I'll yield to you.
On that point, I just want to say, Mr. Chair, directly to Councilman Jones' point, I think there's a little friendly fire going on here. I think the director is absolutely correct. We can't wait for positive lead tests to come back before we do what we know how to do to prevent lead poisoning. And to your point, Councilman, we can't help kids with elevated blood levels if we don't know that they have it. So we need both. We need to test kids to help them when they are poisoned. We need to do what we know how to do to prevent them from being poisoned in the first place.
And thank you, Mr. Chairman, to Mr. Harsh. I won't, I'm just adding an extra tool. So I appreciate you telling the director, and I appreciate you, Director. I don't want you to think that I'm at any kind of disagreement with you. I just think that we need to put all the tools on the table. When you're working on a car, you need different tools to make sure that you can get that car fixed. So we have the same situation here in the city of Cleveland. Thank you.
Thank you.
Let me say this real quick. What I don't like is that we wait 4 years, I mentioned earlier, and then we're here at the table. I should be calling you every quarter. I should be because if I see some issues and concerns going on, and I shouldn't have to call every quarter, because you're the directors, and you see things, and the mayor mentioned a risk analysis, and you come to the table, and you don't even bring the tools, the risk analysis here. You don't bring it so we can look at it to see how you're measuring risk. Because we don't know. You're here asking questions, and you're saying, look at lessons learned. They might have the tool, council member, but they here at the table, and you don't bring the risk analysis here so that we can see, because from that risk analysis, then you execute in the direction that you need to go.
To the chair, some of our flyers here, so thank you.
Here, let me see what you have. Yeah.
But through the chair, just to clarify, that what the mayor is discussing is a risk assessment, and that's what Director Martin O'Toole will discuss in her portion of the presentation. And I'll get out of the way.
And with me, I'll call you probably tomorrow morning at 2 o'clock.
Okay.
Yes, I thank you. I appreciate it. I think we're going to close out the screening and testing portion and move towards the presentation from the City of Cleveland. Building and housing and CD, to be clear.
All right, I'm going to hand this over to Councilmember Joe Jones. I mean, you were actually,
That's fine,
yeah.
but it hasn't got to my house. So, if it hadn't got to my house and to the people in the neighborhood, that's a whole different ballgame. So we should do a mass mailing. That's my suggestion.
Good afternoon, Mr. Chairman and council. So I thought what would be very helpful, I have a very brief slide deck. It's not going to take up a lot of time because I know there will be a lot of questions. But I wanted to get into first, and I brought up Karen Detmer and Victor Santillo leadership on our lead team to answer any technical questions about our program. What we are enforcing in Cleveland's lead safe law, which as you know was passed in 2019, is Ordinance 36504, is that property owners or their agents must engage in an independent contractor to perform a lead inspection of their property. The lead safe ordinance allows for 2 types of inspections, either a lead clearance exam or a risk assessment inspection, and it's up to the property owner and their service provider to determine the most suitable inspection type for their property. And I think this is something worth highlighting here because we have 2 options already within the law. So with building and housing, we've been tasked to enforce that all rental units have a lead safe certificate. This relies on a licensed private sector contractor to supply lead clearance exam information to us. They send an application in, and our team evaluates that. We work very much in partnership with the Lead Safe Cleveland Coalition, which has, as you know, and you'll hear more about later, many different types of grants and incentives, as well as a workforce development component to help our residents make their homes as lead safe as possible. So having enforced this now for several years, I think what we can say in terms of concerns that we have in administering this is that although risk assessment is an option, most landlords opt to have a lead clearance exam, which does not provide a detailed list of risk factors for the property. So property owners aren't getting a list to say, here's all the things you should be doing. They're getting a dust swipe to determine if the property meets the threshold of being lead safe. So it's not very informative to the property owner, and that's one of our large overarching concerns. We also believe these exams are costly for landlords, and they don't provide real assurance of lead safety for tenants. And this is part of the alarm that Cleveland Department of Public Health has raised by showing us that 11 people, 11 children living in homes that have been cleared and determined as lead safe are poisoned. And this has been our fear for a long time, and I think now we're seeing the data. So with most of our housing stock being built before 1978, almost all of our houses are at risk of poisoning a child. Unless the lead has been abated fully, there's a risk of being poisoned in those houses. And we're not seeing a decline in those rates, even though we've been enforcing a lead-safe law. This should be a wake-up call for all of us. And as Dr. Margolius said, we can't use our children as the canaries in the coal mine. I mean, that's just unacceptable. They are not our lead detectors. A small number of homes that, we saw this hazard, suggesting that our certification process is flawed. So we'll say that. And obviously, one child poisoned is too many. So how can we achieve lasting lead safety? Well, one of the things that we've already done is establish a small landlord assistance unit, and that is headed by Inspector Victor Santillo, who's now the manager of that program. We are working on a staffing up of that unit to add lead risk assessors to that unit to help some of our smaller landlords, because what we've learned about is that some of our small mom and pop landlords need a lot of hand-holding and a lot of help to get their units into compliance. This is not something that's going to happen overnight. This is going to require a lot of resources. And so obviously, wanting to link them, help them get those resources, help them get to the finish line of lead safety in those homes, and it's going to be a marathon and not a sprint. We believe, and we've felt this way for a long time, and we've said it at various meetings, that we believe a lead risk assessment methodology instead of a clearance exam approach is more scientifically sound than just going and doing the dust wipes, which is typically a process that is used after lead abatement to be sure the house has been, all the lead dust has been removed. It's not necessarily the best proxy to determine lead safety. We believe a lead risk exam is. So we also worked with our partners in CD, who are, yeah.
That could fall into the scope of your risk exam. You could still put the wipes in there instead of relying on that, but it could fall into the scope of it. You think?
So to the chair, we believe that still has a role, but at the end of the process of getting that house to lead safe, to clear it after the work's been done. So yes, we do believe that.
Yeah, I see that.
Yeah. So with our colleagues in CD, we're very pleased that a window and door incentive program was launched. There's about 17 projects going on now with our partners at CHN. One is fully completed, others are nearing completion, so we're very pleased about that. That money that we obtained from the Ohio Department of Development, we obtained $4.6 million, and so that's being deployed to bring homes to meaningful lead safety. So that's been wonderful. And then, of course, Residents First provides us with more meaningful enforcement tools, such as civil tickets for noncompliance. So we have filed 275 court cases against people who have not obtained their lead safe certification. We focus mostly on larger landlords, not mom and pops. We want to work with the mom and pops, and we have met them as we have our new rental registration process out. We were shocked to see the number of older mom and pop landlords that we have, many of them over in their 90s, coming down here to comply with our ordinance and wanting to do their best, but needing some extra help to do that. So we are working on launching a guidance document for landlords and the lead workers. And this is ready to go, but as we, in light of the recent research and our desire to perhaps pivot in a different direction toward clearance exams away from, risk assessments away from clearance exams, we will relaunch that once everything is decided, so that's going to go out. So obviously, the regulatory guidance is going to address how the city relies on HUD guidelines and state law when we process applications. So the changes that we are considering to the program in light of all of this information that we're all very shocked and dismayed about is that we need to look at risk assessment as the gold standard going forward. So, of course, because we're in the middle of this program, we are going to honor those who have obtained a lead safe certification under the clearance methodology, and those would be honored till their expiration. But landlords who have not yet obtained a lead-safe certification would be required to obtain a lead risk assessment and develop a remediation plan if it is called for. So if there's findings on the risk assessment, we would ask, that a remediation plan be created. These documents will be placed on the city's open data portal and provided to the tenants with a sheet about how they can lower their risk while the property is being renovated. So the tenant must sign off on the remediation plan, so they're fully aware of it. We want to make sure the tenant has all of the facts and also knows how to mitigate some of the risk of living in a home that is not technically lead safe. So while we're working through the logistics of getting a landlord's house fully lead safe, we obviously want to have regular check-ins with them to make sure that's going, and that's really where Victor's unit comes into this.
Monthly, quarterly?
So the idea here, Mr. Chairman, is that when that remediation plan is filed, that will result in citations issued to the property owner for being accountable to that remediation plan, and therefore, a period of time, 90 days, let's say, we need a check-in to say how far have you come with that? Have you applied for a grant? Have you applied for resources to help you? If not, we move forward with prosecution. But if they're working with us, we keep working with them, obviously trying to educate the tenant on ways to mitigate any risk they face of being in that property.
Who created your risk assessment?
It
Who
is
created
a HUD methodology. If I can put Karen on.
It's methodology that's been used for years through HUD, and it's the same methodology that Dr. Margolius' team uses for EBL investigations. It's a little, it doesn't have any child information, but everything else is the same. So they're still getting a visual survey of
Right.
the entire property,
Right.
noting where there's any deteriorated paint. They still are doing dust samples, okay, to looking for dust. And the best part about a risk assessment, coming from that world, is that you're giving the tenant something and the owner of that property something back. Here's the assessment of your property, not here's just dust samples, go ahead, you passed. It's here's what your property looks like today, and here's what you need to do to make it lead safe. That's the benefit of a risk assessment.
And if they don't move forward with it, then we move forward with the red hot stove effect. We move forward to the prosecution. When
Correct.
people see people are being prosecuted, then they will start, complying to it. Point and then point. I'm sorry. Council lady.
Mike, thank you. What you just responded to, the risk assessment, how much time is given between that time before the red hot stove effect comes in? When you give them the document saying this is what you need to do, and they don't, and they're not in compliance, how much time are they given?
Through the chair to the councilwoman, at this point, we're talking about 90 days having made significant progress or having gotten into one of the grant or loan programs to show that they're moving this forward. So Victor's team would be working very aggressively to make sure that those follow-ups are being done.
You know what? So you give them 3 months, and I'll yield you in a second, 90 days. But in a risk assessment, you would say in 30 days, if they're not moving it, because you have dependencies to make sure that you're going to hit your 90 days. If someone just sitting right there for the 90 days, we get them with a lead poison. So within 30 days, here's my first dependency. Things are dependent on other things to happen to reach the outcome. So in my 30 days, if you're not executing on it, not you, but the landlord or whatever the case may be, then we need to move to where we're at. I don't want to wait another 60 days.
Good,
Through-
Mr. Chairman.
To the chair.
I'll yield to you. Yeah. I'm listening to you, then I'll yield to the council
Okay.
member.
I think we're considering options here in terms of what we would prefer to enforce, whether it's, the violation comes out and says 30 days, but then, you have to have something meaningfully done by 90 days. It's, something we're trying to work out now.
Well, what you had them give you a progress review where they're at. I mean, because here's something that can happen. I'm not the expert, but if I know I have 90 days, and if this person is not executing, and I know in 30 days or 60 days to be at a certain, let's say dependencies, they're not hitting them, you got to hit dependencies before you can get to your milestones. So it gives me a chance to measure that, and then I can send you a letter saying, you know what, you have 30 more days, however, send me back what you're doing. So, and you can put that in your notice. We're going to give you 90 days, but in the 30 days, you must send me this. In 60 days, you must send me that. But then with 90 days, you hit your milestones. If you don't, and you wait for 90 days, I can have issues and concerns before you get there. You think?
Of course. I do believe that's true.
I
So,
would do that. But I want to yield to council member, then we'll
sure,
go back.
that's fine.
Very briefly, Mr. Chairman, because it's on the certifications here, how many landlords in the city of Cleveland has received lead certificates for their homes being safe?
To the microphone.
So we're averaging, it depends, units, or we issue a certificate by a parcel, okay? So a parcel could have 150 units, a parcel could have one. So it's kind of hard to figure that out. We're at about 33,000 units, okay? So again, one parcel could have so many units. So it's kind of hard to determine, which is why it's so important to have this 1 to 3 unit, because we really want to get these single homes, because that's where a lot of this lead poisoning is actually happening.
So it sounds like, Mr. Chairman, that, just to make sure I'm clear, is that you have more or less dealt with apartment units at this point, has been the bulk of the work, or has it been housing, individual residential homes? Or do you have it broken up where, Mr. Chairman, there is, you can separate between the housing units / the residential homes?
Mr. Chairman, in the data that I've seen, there are roughly 7,400 properties that are 1 to 3 rental units. And as far as the lead certification, we have not differentiated between apartments and single-family doubles and whatnot. As they come in, we address those properties and do our reviews and issue or fail the certification.
Yes, Mr. Chairman.
Mr. For clarity, 7,400 units with a lead-safe certification, or 7,400 units what?
Total for the 1 to 3 unit properties.
In existence in the city?
Yes,
There are only 7,400 1 to 3 unit
rental properties.
rental properties in all of Cleveland,
Under our rental registry.
under the rental registry.
So, through the chair, if I could provide some clarification. Typically, there's about 60,000 registered units in a given year. And our lead safe auditor, Rob Fisher, likes to point out, he believes there's about 100,000 total units of rental in the city of Cleveland. So there's a shadow inventory of properties that have never made it into our rental registry that we are very keen to go after. And so we intend to. And it's going to help us greatly, I know, with our friends at CMHA, sharing information with us under an MOU, so we can crack down on those who are under the radar, like what Councilwoman Gray was talking about, where children may be living in places that are under the radar for rental registration we need to crack down on.
So, Madam Chairwoman, just for Madam Chairman, to the distinguished lady, the director. So it seems like the question is for the lead certificates. So let me just, if I could just, because now it's confusing to me, and it would take a lot of time on a point to try to untangle the knot. So the question would be, Mr. Chairman, how many certificates lead certificates have right now been sent out in the city of Cleveland saying that these properties and homes are safe and up to par?
Through the chair to the councilman, it's around 33,000 units have been lead safe certified so far, which is well above what our peer cities have done, but absolutely inadequate given the scope of our problem.
I see. And so you've been able to accomplish this so far. So you have 33,000 units that are now lead safe. And then is there somehow moving forward, Mr. Chairman, to the director, we'll know on like neighborhoods like mine, which is not, don't have a whole lot of apartment units, but we have single residential homes. How can we find out, how many certificates is it? Can I be able to look in your database and it shows me how many lead safe certificates are actually in my ward?
Through the chair to the councilman, the good news is we should be going live with our new lead portal at 4 p.m. today.
Oh, good.
Amen, amen. This has been a saga, as most of you know. So with Residents First, there was a wholesale retooling of the Acela database, and a lot of new portals had to be developed. So lead safe was a big sticking point, and we kept running into some issues. However, I am told from our wonderful Faranac in ICS that we should be moving forward at 4 o'clock today. So the idea here is that all of our data will be transparent and visible, and give us a little bit of time, but we will get it there. So,
Mr. Chairman, I don't want to belabor the point, so I yield to you. I appreciate you giving me the liberty to try to get a little clarity here before we move on in the
So
screen.
let me ask you this question, and I'll yield back. My assistant, I need to see her. Quality control, you have that department in building and housing?
our whole department is about quality control.
No, you need an expert to do it with the quality control, because we waited until the end of the year, or at least over the third quarter, to switch to a risk assessment. But you saw that the certification process was not working. When did you see that it was not working? And then we need tools of risk assessment, because with me, and the doctor mentioned prevention, and if you're focusing on prevention and monitoring and controlling it, then you don't wait until now and say, let's go into a risk assessment. If you see something is not working.
To the chair, to your point, I believe this team saw that right away. I think we've been pretty vocal about it, but we're also enforcing an ordinance that has language in it that we are enforcing, which includes allowing a clearance exam. So chances are high we're going to come right back to you with some legislative changes that we think is going to, make this process better. But for now, we're enforcing what we have to enforce. I think we've all aired our concerns over the long haul about, is this clearance exam a proxy for lead safety? We're not so sure. We got a lot of feedback from landlords along those same lines.
So let me say this, and then I'll yield one quick second. I call you, Director, whenever there's an issue and concern. I forward text to you, the whole 9 yards. Whenever there's an issue, there's a concern. Just call me, tell me. Say, Councilman, can you stop by to see me? Whatever the case may be, you just gotta let me know, because I do you the same way. In fair exchange, as they say in my neighborhood, it ain't no robbery. So just let me know.
To the chair, one of the things I think that was really eye-opening for us, and this was just over the last week, was the fact that there are 11 overlaps between lead poisoning cases and our lead safe certification. So that really did raise more of an alarm for us.
Right.
No, we didn't think it was a perfect system, but we didn't think it was totally failing. But if you look at the 33,000 we've certified, there's 11 that have been poisoned. So, we've been doing the best we could with it, knowing and working with Councilwoman Moore, who is definitely a subject matter expert in this, to talk about potential changes to the ordinance. And also this involves our coalition, who, it involves our partners outside, our private partners. And so we've been all discussing this for some time.
Well, I have Harsh and then Star is down also. I just see my assistant real quick on an issue. She's ready.
Through the chair, I just want to make sure we have these numbers right, because there's a lot of math flying around in the room, and I want to make sure that we're all got the numbers right. So Through the chair to the director, there are 33,000 issued lead-safe certifications in the city of Cleveland.
Units declared.
Units declared okay. And there were just under 1,500 children with an EBL, an elevated blood lead level last year. Just under 1,500 with an EBL. And we looked at those 1,500 and found 11 of them in units with lead-safe certifications. Is that right?
Yes.
Through the chair, so the 1,500 is referring to cases at 3.5 micrograms or above deciliter.
Yes.
So the 11 cases were cases that were 10 or greater, and our team found a source of lead poisoning in the unit.
That had a lead-safe certification.
Yep.
So the 1,500 were 10 and above.
1,500 were 3.5 and above.
Okay.
1,500 kids in Cleveland, 3.5 micrograms per deciliter above lead poisoning. About 18% of kids tested. What we're looking at here is of units that were deemed as lead safe, a kid who lived there tested positive, and our health inspector went in there to do an investigation, found the source of lead poisoning
In 11.
in 11 units that had a lead safe certificate.
And so through the chair then, if my math is correct, then we had 32,889 units with lead-safe certifications where we did not find a child with an elevated blood lead level.
Through the chair, so we didn't find a greater than 10 level where our team then went and did the investigation. We're not saying that there weren't instances of 3.5 to 9.9.
Wouldn't it follow through the chair that the majority of the kids who are being tested, that are testing high lead, are not in units with a lead-safe certification? The overwhelming majority?
Through the chair, I would think so, yes.
So through the chair, it almost seems like the lead-safe certification has given us pretty good indication of where homes are safe, and the overwhelming majority of people that are testing high blood levels are in units that have not been determined to have a lead-safe certification. I almost feel like we're kind of proving that this program is working to sift out which units are.
Through the chair, I know that those 11 families don't feel that way.
Oh, of course not. Of course not. Of course not. But if you do the math, 11 out of 1,500 in units that had an LSC, but the other 1,400 whatever in units that didn't have an lead-safe certification, the problem seems to be majority in units that don't have the lead-safe certification. Okay, that's important.
Thank you, Councilman. I think I didn't want to interrupt because I feel you're fully entitled to make the point. I think that I would disagree with it, and I also think that there are the denominator is a little bit. I want to make sure we're just very clear on the denominator, because the greater than 10 micrograms per deciliter amount is about 150 to the director.
To the chair, about 250, 150 to 250.
150 to 250. Yeah, so that's the denominator of the greater than 10 micrograms per deciliter.
Excellent point.
So I just want to make sure we're going apples to apples. And I also think that the promise of this program, the dream we were building, is to make properties lead safe before a child is ever poisoned. And so if definitionally children are poisoned in properties that passed this program, that is worth inquiring into the scope and nature of the program and whether it is succeeding at the fundamental dream we're trying to realize.
And Madam Chair, I would agree that we all are on the same page that any lead poisoning is too much. But we also always knew that there would be homes with lead-safe certifications who later had a child with an EBL. You can test a home, have a lead-safe certification on Monday, punch a hole in the wall on Tuesday, and have a poisoned kid on Wednesday. I mean, that is just the way it works. The lead-safe certification is a snapshot in time of that day, and anything can happen the following day that makes that home no longer lead-safe.
Yeah.
And we've always known that. These are like the limitations of human prevention, right? We can do everything we can on Monday, but if something crazy happens on Tuesday, on Wednesday, we can have an unfortunate consequence, right? So we've always known that that was going to happen.
Yeah.
Right, okay.
I think that is for the testing standard we were using. That is what is very likely to happen and what has now been proven here. And now it's raised the question of whether that means we have to change the testing standard as a result of that. I want to turn it over. I believe Councilwoman Gray is next on the list.
On the testing example, just a point of question.
Okay.
Yeah, because you seem like you're the expert on it. So I'm curious about this.
I'll yield just on a point. I just want to make sure we move through this because I think I have Councilman
On the
Starr
point of
next,
testing.
who hasn't been able to ask questions yet.
On the point of testing, I see that there's been a change from a certain amount over the space and time all the way down to now. So right now, is there any acceptable level, or when we talk about the changing of the levels, what would you, if you have something less than what we have as the standard, can you explain how these changes happened over time and what was presumed acceptable, which is now not acceptable, to where we are now?
I think you're talking about elevated blood lead levels, and
That's
so
correct.
I'll maybe hand it to Director Margolius.
Through the chair, I think I'm getting my decades right. In the 1970s and 1980s, it was acceptable for kids to have a level that was less than 60 micrograms per deciliter. And the argument from 60. And the argument from the lead industry, from the paint companies, essentially was that lead is on the periodic table, it's natural, it should be in the blood. But now we know that any level of lead in the blood is harmful, and the higher, the more harmful it is. And so the threshold over time has dropped and dropped and dropped to track with what most of the country's children are experiencing in terms of lead poisoning, to the point where it's now, the threshold is 3.5 micrograms per deciliter as recommended by the CDC. And so that's what we're looking at across time here, and recognizing that no level is safe.
Thank you. I appreciate that, Director. I believe I have Councilman Starr.
Good afternoon. Thank you, Chair, as well as Chairman Conwell and Councilwoman Moore, for hosting this Lead Safe Coalition. Just for clarification, I know it's been a busy morning, and I don't want to be long, but I'm just frustrated with the city of Cleveland. And what I mean by that is, if we knew in 1978 homes was built using lead, and it became a law, federal law, you telling me in 2024 we're still talking about what we haven't been able to do, how hard and difficult it is, how much we need to just tear things down and rebuild them, and we talking about from 1978 up until 2024, we still talking about the same stuff. It's as if we're just looking for headlines for the media to look like we're doing something, but we're really not getting rid of lead. If it's a major problem and it's affecting families, we should do everything within our power as a collective unit to make sure this is resolved. And that's where my frustration lies within lead. I mean, I've without no facts or without having no numbers or data to back up my argument for years, the last 2.5 years, I mentioned public housing. I mentioned lead issues in these type of areas just off the fact of that I grew in there. And I always taught things up to the reality. We cannot talk about violence is spurring in our neighborhoods, in our city, when we got people who got high levels of lead. If you look at the direct correlation, you look at education system, you look at what people living in their home environment. If I got high levels of lead, of course I'm acting out. Of course I can't functionally think the correct way or make the right appropriate decision or choices when I'm put in a situation. But no, we've been knowing since 1978 that we had so much lead in these properties that were used to add paint. And then there's some who say that Sharon Williams had a whole bunch of paint afterward that was created, and they still potentially was still selling that paint. So my question would be directly to building and housing. Do we have an actual list of homes that we can look at a table that shows how many homes that are still here exist that were built before 1978 through the chair?
Through the chair to the councilman, absolutely.
So
The majority of our homes.
So the majority, so we can have a list. Do we have like a spreadsheet to say, this is the
60,000 or 70,000 homes till this day that were built before 1978. Do we have that?
Yes.
Can, through to our staff, can we make sure we get that information sent over? Because I would like to definitely look at that to get an understanding of where we are at. And then through that, we do have any record to show from 1978 up until today, which homes have actually made some improvements as far as being lead certified within the laws that we have, as well as in compliance with federal laws. Through the chair?
Through
Yeah.
the chair, we can give you a list of the properties that we have issued lead-safe certificates on, and those that have been abated through various programs, because full abatement would mean removing all the lead hazards in the home, and there are a number of Cleveland properties that have met that standard.
Okay, thank you. And then from, through the chair, one question I would say, so on a rough estimate, or do we have a data that shows which homes, units that needs to get tested that haven't been tested? Do we have anything on that information as well, to the chair?
Through the chair, that's a fairly easy number for us to back into, because we know which 33,000 units have been certified and which are still in our rental registry that have not. The number that we don't have a great proxy for would be the ones that have never registered in the rental registry but are a rental. And so we're trying to extrapolate that figure as well, so that we can go after those property owners to comply.
And through the chair, what is the process going after a landlord who is not in compliance with the lead, just to make sure I got clarification? I know you spoke on that. I just want to make sure I understand, like, okay, this one has not been rental registered certified for lead safe home. What can building and housing do to hold them accountable, not just slap them on the wrist, but let them know this is a major issue and it needs to be something dealt with immediately? Through the chair.
Through the chair to the councilman, there's several ways.
Okay.
Residents First gave us a third way. So essentially, we were using minor misdemeanor tickets as our first enforcement tool, which then could be escalated to a minor misdemeanor, or an M1. So not responding to a letter from the director yields an M1, which is a higher fine, potential jail time. But now we also have civil tickets, which we're launching as another tool. This is very helpful, especially with out-of-state landlords who just ignore a court summons and don't come in. So this is money that they're billed, and if they don't pay it, it goes on their property tax duplicate. So it's another way of attacking that. And so that's primarily what we'll do first now, will be minor misdemeanor tickets, kind of pivoting away from, we will do the civil tickets versus the minor misdemeanor tickets as a
Okay.
first stab at it. And then we'll move up to M1s if we have to.
Okay, and then just because after what you just said, Director, it just made me think, is there anything in place that I know you said about the fine and going their taxes. Is there anything that we can do as far as garnishing of homes if they do not have them in compliance? Just for something that just hit my mind
Yep.
when you were speaking.
Through the chair to the councilman, that would be a lien against their property
Okay.
if they fail to pay it.
All right, so that's great. So from my knowledge, I just want to make sure, because I be pulling data up on my own sometimes, and sometimes I read it a little wrong, sometimes I read it right, and sometimes I be real direct with it. So when you talk about the getting rid of lead or the issues with lead, first you got to do a test for lead, right? And then you have to identify the source for where the lead is coming from in the home. Then you have to remove or contain the lead. When you talk about remove, contain, what does that actually looks like as far as getting a house in compliance through the chair?
Well, there's several different methods currently that are acceptable. Some are more of, I'm going to call it a temporary method. They're called interim controls. So you have flaking and peeling paint. You stabilize that paint and repaint. You also have the abatement method, which means you've got peeling and chipping windows and you replace the window. So you don't even have the paint there anymore. So there's two separate things they can do. We will issue a 20-year exemption certificate if they remove all the lead. And we do have some that had that done, definitely. What what most is happening right now is they're doing a clearance test, which means they do a visual. They may repair something, they may not, and they do dust samples, and that's it.
Okay, so also within that process, do we look at the different pipes that may be in the home? Do we look at different paint that was already in the home? From when you look at it from the removing of the contained areas of the home that may have lead, is like removing the pipes is one of the things that they also might have to do through the chair if it's deemed the source where the lead is coming from through the chair?
So we rely on our water department to handle anything that has to do with water or pipes. We do not do that with this lead certificate program. They do have a pretty good system on identifying streets and what's been worked on and what's not. So it isn't pipe work, but it is anything painted.
Okay, and through the chair, definitely. I know Director of Public Health has spoke and said that there is no source of lead in the water. I was listening on YouTube. I definitely chimed in, so I heard that. So from that standpoint, within the homes, the water do not do testing, or based off that fact there's no need for them to do testing if homes may have lead in it as far as finding the source through the pipes, through the chair?
Currently in our lead safe certificate program, we do not address water. We have information from the water department that we can give them, and that's available for them to get their own testing if they feel they need it. But they can contact the water department and get all the information they want.
And through the chair, for those children who test positive for lead poisoning, as part of the investigation, the water is tested, and it's always negative.
Thank you so much. And then also, definitely, I believe, so I can wrap it up because I know my time is coming up. I look at the clock. I'm almost 12 minutes in. But our chairwoman, I know we got Lead Safe Coalition coming up, so I'm not going to harp on that. I probably talk to them more in depth because, I think, was it 2022? We got the $100 million investment with private, public dollars, started off at 38 million up to 100-something million. My thoughts is what is actually taking place since we have that type of investment, as far as making sure most of these properties get the support and the need as far as financial and the resources available. And then also, through one last question as I wrap up, to the chair, to the director, Building and Housing, Director Martin, with HUD and the federal government, different grants that's available for lead safe, to get your house in compliance with lead safe and protocols, do we have any record of how many grants we have went after and how much funding we've received to be able to help support this initiative? Because we already had something said about 60,000 units, and we talking about almost 40,000 that may need to be brought up to code, just to figure out what is our actual aggressive, assertive plan to be able to deliver this. Like I said, 1978, we found out that a lot of our properties was built with lead. Now we're talking about 2024. We can't keep saying 1978. What is our assertive plan to get more funding to be able to get this work done? Through the chair.
Through the chair to the councilman, in future presentations here with the coalition and also with our colleagues in CD, you'll be hearing more about that, because Building and Housing does not administer any home repair programs.
Okay.
Although, we did work with ODOD to obtain the $4.9 million from the window and door program.
Thank you so much, Chair, and I yield.
Thank you very much, Councilman. I will hand it over to you, Councilman's Life.
Thank you. So throughout the presentation, we've heard there's been a lot of statistics about, inspections, but also rental registration, parcels and units, and I think the common thread is, I'm not saying good work isn't happening, but there's still this enormous pipeline of work that we haven't even gotten to. So I guess my first question, well, before the first question, a continuing challenge has been the difficulty of getting all property owners to engage with the city of Cleveland around our housing laws, whether it is a certificate of disclosure or a rental registration or a lead safe certificate. So now what's being brought before us is a suggestion to make our regulations more stringent, but we are having difficulties even enforcing what we have. So I guess the question is, to what degree is this a failure of our regulatory system versus just a understaffing? And is another strategy to all of this to be finding money to beef up staffing? And if there are, and I'm not going to ask my questions about like grants and incentives now because I think that's more of a CD question, but if there are dollars that are not going out, should we be putting that money towards staffing? When are we going to start talking about the stick? We focused a lot on the carrot.
Through the chair to the councilman, we have sticks. We're deploying sticks. We're also staffing up the Department of Building and Housing. So as you know, he gave us some additional staff last year. So we've just onboarded our 20th new hire for the year. We have about 6 more in the pipeline. We're continuing to staff up. Yes, we know capacity has always been a problem in the Department of Building and Housing as long as anyone can remember. And so I think with your generous ratification of the Residents First legislative package, you've also given us more tools than we ever had. So we appreciate that greatly. And I think we've got to give that some time to show its worth. But I think combined, our continuing staff up, it's helping.
And through the chair, if I may add, hear what you're saying, that criticism is going to be out there that we're not enforcing enough. But I caution us to stall for that reason, to think that, okay, better enforcers are going to come, more enforcers, someone somehow, better than our director of building housing, our department. I mean, this is a really good team. They're going to continue to get better. But in the meantime, we can't wait while the same number of kids are being poisoned every year, and some of them in the lead safe certificate clearance tech approved homes. So I think what we're saying is we will continue to work on that enforcement, but we've got to have a really hyper focus on what can we do to get properties to lead abated much better, something in between there, building more homes so that more children are not coming back to this and we're not waiting for more and more enforcement as our answer out of this.
Sure, and I guess, to the degree, it's not, I don't think, a controversy to say that there are landlords who are just not seeking to comply with the law. Yep. I don't believe that making the law more strict is going to suddenly make them more eager to comply with the law. So I do think that staffing side is important. Something I've asked for routinely across the entire city is I'd love for us to have what I call the aspirational budget. If our goal is to plow every street within 2 hours of the snow ending, we probably know we're never going to be able to afford that level of service. But if that's our goal, have we ever even quantified that type of thing? So in this example, I would like to just know what jaw-dropping number of what the building and housing budget would actually need to be to have staffing not be an issue. I know that we're bringing on more people. We are trying to scrape together every dollar we can to provide it to this, but I still don't think it's going to be enough to ever satisfy all of us. So, but I do think that it would be nice to have that as sort of something to aspire towards, so that we can at least be transparent with the public and say, we know we're not at full capacity, but we recognize that we're moving towards it as to the best possible way that we can. So if it's possible for us to get that, of really just be upfront with us, what would this require, and then we can kind of back away from there of what are we able to provide given our revenue sources.
Through the chair to the councilman, aside from our staffing and our enforcement, one thing I think we need to elevate here is the amount of poverty in the city of Cleveland, the amount of homes that are over 100 years old, the amount of historical disinvestment, the amount of redlining, the amount that banks aren't stepping up to lend to our residents to keep their homes in good shape. So we're trying to solve a problem that no one solved in a situation that's extremely adverse for all of us. And so it's more about resource deployment. We need money to fix homes, and we have money, which we're very grateful for, it's not going to be adequate. So we're going to do the best we can. But we also have to arm our residents with the information to keep their kids safe, even if they're not living in a 100% lead-safe home. I am not living in a 100% lead-safe home. My home is 100 years old, and if you were to go to each window, you might find some chipping paint, right? We're trying to keep on top of that, but it's there, and it's a constant issue. So if they know they can use a baby wipe to wipe down that window every day, they should be doing that. Right? If they know they can be feeding their kids high iron foods and high calcium foods to keep their kids safe, they need to know that. So we have to arm them with ways to prevent poisonings, even as we try to find the resources and combat historical disinvestment and redlining by holding banks accountable and things like that that we're trying to do to start providing more investment in our communities so that we can start rising above some of these historical challenges.
Sure, and that's, thank you, and that's an important point. And I'll say, over the weekend, there was an op-ed in the Plain Dealer about, it was actually about stadiums, but the line was something to the effect of, government needs to stop feuding over limited resources. And I sort of took exception that the author of it was a retired CEO who moved his business out of Cleveland and moved the headquarters to Ireland as a tax haven. So the issue is money. The issue is that we need investment in Cleveland, and we need our entire community, residents, corporate, philanthropic, what have you, to recognize that this is where the needs are and that we need to work together to make sure that we have the resources necessary. In any case, I still would like to know what that aspirational figure would be, if only for my own edification. To the chair, a group that I don't think has been at these hearings is the judicial branch. So I'm going to ask the question, but I'm not going to know that the administration will know off the top of their heads. 275 court cases. Do we know what the results of those court cases have been?
Through the chair to the councilman, we don't have Dave Roberts here today, but he would have a great update for you on that, of the 275 matters that we filed in the court.
Okay, if that could be provided to us, I want to make sure that there's nothing falling off once things do get referred over to housing court. And then also I will say that, if 275 court cases have been brought, I'm sure that there are hundreds, thousands of more that could be. So I also think that's an area where if we are going to speak of the stick, how are we making sure that we're putting enough resources towards the law department to allow those cases to be prosecuted? My final question, so there's been some stuff in the news recently about the Biden administration, EPA funds for lead service lines. We have our own program here in town, and we started with daycares. If water is not the source, why are we spending money on this? And I think it's important because we have all, Councilman Jones was saying it, people hear Flint, they think water. Everyone keeps going back to water, and now there's all this money out there. We don't need, arguably, money to fix our lead pipes. We need money to renovate homes. So that's just pointing out a disconnect, but I would like to know, answer the question, but also what are we doing to advocate to the federal government to essentially say, hey, that's cool, but that's not actually what we need, and that's a great offering, but that's, per the logic of this conversation, not going to lead to a substantial decrease in the number of children in the city of Cleveland that are poisoned by lead because they're not being poisoned by our drinking water and the pipes that it's coming through.
Through the chair, thank you. Certainly, we are grateful for the investment to get out all of our lead pipes, but it's true. I was on a call last week and was like, we have the highest lead poisoning rate in the country, and it's not from our water, but we're hearing about this billion-dollar investment in pipes, which is really important, but we need the same thing in homes. And so that's why I don't think we should say, like, it's too expensive to do everything we need to do with homes. I get that as a limit, but just as like with the lead pipes, we need to aim as high as we can. And so thank you. Absolutely.
Can we pen some sort of joint letter from the council and the administration to to underscore that we need funding beyond pipes. I mean, this just seems, it's again a great program, but it doesn't seem like it's the program that we need. Maybe that's what other communities need, but I would offer that as a way that we need to align ourselves and advocate upward to make sure that our children aren't getting left behind.
Let's do it.
Okay, let's do that. So, all right, thank you.
Thank you. I apologize. I was negotiating over lunch. I think Councilman Jones would like to make one point, and then here's what I am anticipating and want to run past everybody. We've had a full room, both here at the table and in the back, and I see truly the brain trust and committed advocates who have worked on lead across the entire city. And the reality is that we have a lot more to get through. We have community development, and then we need to hear from our partners in the private sector over the implementation of the $100 million funding for Lead Safe Cleveland Coalition. So I do want to break for lunch out of respect for everyone in the room who's taken time out of their day, but I expect us all to reconvene promptly and in full numbers. But if I could give one point to Councilman Jones, and remember, you're between us and lunch.
Well, I'll make sure that I'm very brief, and this would more or less be to our staff too, because we may not get the answer here. Over the time, we spent over $100 million demolitioning homes on the east side of the city of Cleveland, and that's a lot of money. So those funding sources that we use to demolition homes, can we use those same formula and funding sources to be able to rehabilitate homes when we talk about investments and where resources are located?
Through the chair to the councilman, that would not be adequate funding. And we still need demolition funding to take down the worst properties. And you know, in your ward, they come up all the time. We've had to do a lot of demolition. So I would say that wouldn't be where we would want to take the money from. But I appreciate the thought.
Thank you. I have bad news, though. Inez, it's good to have staff that are smarter than you, and she has pointed out to me that finance is convening at 2 p.m. And so if we do not keep going through, we just will not get through everything today. So here's what I'm going to ask. I'm going to ask that both community development and LSCC come to the table and give their full presentations prior to questions from the committee, and then we will head to questions from the committee for both community development and Lead Safe Cleveland. All right, we're going to go through it. I apologize for everyone who was hoping for lunch. I got everyone's hopes up, and then I dashed them. I apologize. This is don't overpromise and underdeliver is the #1 rule of government, and here we are.
All good. We will certainly be as brief as we can be with a lot to get through today. But I'll go ahead and get us started. So I wanted to start off with some context about the role of community development within this ecosystem at the city. So our role is to take the dollars that we have, typically federal dollars, and to deploy them in the best way that we can to get them out on the street. We do that in 2 primary ways. The first way is in-house programs. These are programs that our staff manage, and we will talk a bit about those programs with Tony Scott, who will join us at the table in a moment. He was caught up in the almost lunch, so he'll be joining us shortly. And then we have our bureau chief, Danette Davis, who has been our bureau chief since about midsummer, and is responsible for the home repair programs that we have here in the department that we direct in-house. I also have with me at the table Gina Ventry, who is the lead for all of our emerging funds, emerging programs, and that includes funding from ARPA. And so she will talk about grant management and accountability for those dollars that we have out on the street through partners. So again, the ecosystem here is that we have in-house programs, we have programs that we pass through to outside agencies, and we'll speak briefly about them today. A couple of things that I wanted to cover about how we as a department think about home repair and lead. It used to be that we would talk about lead in terms of this is the lead grant 2019, this is the lead grant 2021, this is the lead grant this or that, this is the healthy homes, this is the paint program that's meant towards getting towards lead, but it's general fund. And all of that was well and good, but what it did was it missed the bigger picture. The bigger picture, and I think Sally, Director Martin O'Toole, really set the stage earlier, talking about the condition of our houses and how old our houses are. The vast majority of our housing stock was created prior to 78. That's that line in the sand where that lead rule comes into play. When you take an old housing stock with a city that has residents that are majority low income, we know this, right? We know our average income is very low here, as it's typically noted, we're one of the poorest cities. When you put those two things together, and then you add in that many of our homes are not owner-occupied, they are rented, and then you're adding things in like, well, who's renting out those houses? Who are the landlords? Are they, mom and pop, neighbors? I live in one side of the duplex, I rent out the other. Yes, that is the case, but we also know that the case is that there are landlords that are absentee landlords from outside of the state and the country who are, we call them investors typically. I like to actually call them disinvestors because I think the way that they practice landlording is a very extractive practice. So we know all of these things, right? Nobody is getting this information for the first time at the table. But that creates what is a bit of a perfect storm, which my department is working hard to make sure that we are abating lead at every step towards abatement. So we are doing that through shifting how we think about home repair to braiding funding. It doesn't matter where the dollars come from necessarily. What matters the most is that each house, we are understanding what the needs of that household are, and that we are pairing whatever funds we have, whatever resources from whatever source, we're pairing those funds together to get that home in a safe condition. At the end of the day, our goal is to make sure that as many residents as possible are living in a place that is safe for families, for children. We are doing this in a few different ways. We're bringing in additional support. So one measure of support that the department has already brought in through our reorganization last year was we brought in 5 regionally focused community engagement specialists. These are the boots on the ground. I know my phrases. Those are folks that are out in the community, engaging with residents, getting a better understanding of what those residents' needs are, translating that information back here to HQ, if you will, so that we can design our programs to meet those needs. Those 5 or 6 additional folks that we have are in addition to the 15 or so, 13 to 15 community engagement specialists that we have out at the CDCs who are also boots on the ground. So this is our ability to get information out as well as taking back information so that we are making good decisions. And then the last point that I wanted to hit on is it's about bringing in the right people to do this work. This is harrowing work, and we have to have the right committed people at the table. As a director of community development, there is no way that I can be an expert in all of the things that my department is responsible for. Therefore, it is my job to support and to bring in and then support folks that are committed to doing this work, and I've been able to do that. And so, what you'll hear today is where we are now and where we're going. Where we are now is not where we want to be. We came to the table, and you'll hear us apologize quite often that our programs are not doing everything that they could be doing, that we have not, as a department historically, been the most efficient or effective. That is changing, and it's changing rapidly, but that change does take time. And in order to get to a place where we can move forward, we have to do some unwinding of what was there before. That's the process that is taking place. So what I hope you will hear today, I'm going to go to Assistant Director Tony Scott, as well as Bureau Chief Danette Davis, to talk about where we are in terms of the HUD funding that we direct in-house.
This afternoon. Good afternoon to the chair, to the distinguished panel. My name is Tony Scott, not a stranger to any of you. I serve as the Assistant Director for the Department of Community Development. The slides you see there are actually secondary. I'm just going to talk to you for a moment, address any, I'm sorry, I did hear the instructions. Then we'll hand off to Gina Ventry, who manages our emerging programs section. And so that way you can hear about how we've been spending different grant dollars. We did share some numbers. We received the request from the chair. We sent some numbers over the Friday. I believe you may have gotten them from Emily Collins. So just briefly outlining two of the grants that we use in our Bureau of Residential Improvement, which is overseen by Bureau Chief Danette Davis, that's sitting next to me. So the two respective grants, the High Impact Neighborhood, also formerly known as the Glenville Grant, and the Lead Hazard Control Grant, which is our citywide grant. So the numbers that you see are over, they're not on the slide, so hopefully you all have them in front of you. To the chair, does everyone have them, or do I need to read them out?
This is I apologize, Assistant Director. This is,
Yes.
Yeah, so for everyone who's following along on their tablets, this is the LHC Grants 2013, and Inez, if you could pull it up on the board, it's a singular page PDF. Again, LHC Grants.
All right. So I'll take the liberty of reading them because I see not everybody may have them. They're not up on the screen at this point in time. So what was allocated, and to be clear, the numbers I'm going to share are over the life of the grant. So I'm going to reiterate what the director said, that we've had some challenges, but more importantly, I'm going to point towards some transformations that we have in place. So what was originally allocated with the Glenville grant was that $5 billion? No, it was $5 million, $5,700,000. At this point, we've spent close to $1.5 million with a balance of $4.226. There'd been a total of 164 applications received. 51 are active, meaning they're in various states of getting the necessary documents, approvals to move them towards production. 51 jobs completed, 3 in progress. And there was in the narrative, you'll see that 75 were either denied, canceled, walked away, or no bids from the respective contractors. If the result is no bids, we do try to identify another opportunity to put it out to bid for another contractor. From the lead hazard citywide, the allocated was $9.7 million. almost 2.1 spent with the balance remaining of 7.6.
You know, Assistant Director, this is just so critical. I want the public to be able to see this.
Okay.
Ms. Inez, is it possible to pull up on the screen? It's on our tablets. The one-page PDF LHC grants. So I actually, maybe just a helpful orient. It's actually good to have kind of overlap between CD and Let's Say Cleveland Coalition because you all administer your own grants. You
Yes.
also administer some grants that are administered by or put through by the coalition, and the coalition has their own funding. So we're kind of going to have a little bit of an overlap
Yes.
as we go through. But this is now, right now we're talking about the CD only grants that are administered by HUD, that are given to us by HUD.
To the chair, that's correct. And only for further edification, these are grant dollars that we spend internally in our home repair, renovation, and lead abatement program. So these are funds that are entirely utilized within CD by our staff and the contractors that we engage.
Yeah.
And Chairwoman, these numbers represent those that are directly tied to lead, programs that are directly tied to lead. We do have additional home repair programs, and really, at the end of the day, the more home repair we can get, the more new housing we can get, the better it is for getting as many of our residents into safe housing.
Great. I really appreciate that. Thank you for letting me pause to pull this up. I just think it's so critical for people to see it visually. Please continue.
Clarification, Madam Chairwoman.
You know
Just wanna
what?
understand where the grants are coming from.
These are the HUD grants.
Okay, HUD, these
Yeah.
are all HUD grants?
Yes.
Okay.
Yes. And to the chair, so because the numbers are up there and I know we're going to deviate to questions later, I won't read them aloud, but I do want to point to a few things that we're doing. I believe I heard Councilman Slife, to the chair to Councilman Slife, speak earlier about our timing and realizing when it was necessary to pivot. So we've been pivoting for the better part of this year. There's some initiatives that we have in place in order to, and again, to the chair, to Councilman Slife, to address some of the challenges that come with staffing, for example. So we have 3 initiatives I just want to share with you briefly, and then I will yield. The implementation vendor. The implementation vendor is an RFP that we put out at the early part of this year. I believe it was in February with a turnaround time in April. So we're working on the contract with that. What the implementation vendor is, in short, is a construction manager, recognizing that we have challenges with being able to produce the amount of production that we need in home repair, renovation, and lead. We put out an RFP to a third-party vendor that will be responsible for increasing our contractor pool, generating the specs, monitoring the project, assigning the contracts, monitoring the projects, paying the contractors out incrementally, because that's a challenge. It wasn't something we were able to do, but we did hear the contracting community that they needed dollars at startup and along the way. So they'll be responsible for paying that out. Our city staff will still monitor the projects along with them, as well as be on site for closing permits and moving things forward. So we're in the contracting stage now. It's a 1-year contract, $6 million, subject to renewal for 2 more years. There's an intent, the intent is, the metric, is at least 275 units will be completed. To clarify, that's 200 in repair, 50, did I misquote? I'm sorry. It's I'll verify the number, but it's 50 are in lead, 200 are in home repairs, and 25 are in renovation, at least per year. So we're really excited about that. We're at the contracting stage now with the vendor that's been identified. The LESs, the Lead Engagement Specialist, that's our working title. Recognizing that we wanted to improve upon the pipeline between the Department of Health and through CD, we're using grant dollars to hire 2 community engagement specialists that are going to be embedded within health. That way, any of the concerns about HIPAA-related matters not being able to successfully transfer, they'll be in there. So as we continue to identify locations that are hotspots that need more attention, health staff will be able to more readily deploy persons that we're paying for, but will be under their leadership to go and assist people on expediting those applications. We're starting off with 2, but we are not opposed to growing that. We want to make sure how the program works first. And finally, third-party risk assessors. I can't take credit for any of these, but particularly not this one. Bureau Chief Danette Davis and Alicia Moyer, who is one of Gina Ventry's staff, collectively came to this decision. Recognize that we don't have enough staff to be able to move the production on lead initiatives. The third-party risk assessors will be contracts, small contracts, put out to bid, where risk assessors will be able to come in, be able to assist with the monitoring of projects, actually doing the work, prior to any of that, the scope and the specs, being able to do that so that way we're able to assign them work as well as being able to assign it to the implementation vendor. We're hitting it both ways because the implementation vendor, with the size of that initiative, we know it's going to take a scale. So we're looking to have the contract done next month, start being able to give them projects with the intent on being full scale in the spring of 2025. Meanwhile, while that's happening, we can assign work to the third-party risk assessors for projects that are already in the pipeline to move it forward. So we are sensitive to the fact that these numbers do not show the complete passion that we have for this, nor do they show the success that we are going to have, but we are moving internally and we are in continuous communication with our HUD monitor, not only about where we are now, but also trying to pivot and trying to figure out ways to be more expansive with our reach. And at that point, I'll yield and I'll pass to the director and/or Gina.
Okay, we'll pass it over to Gina Ventry, who will talk us through those grants that are coming through the department and out to our partners at the coalition, who you'll hear from a little bit later. Our primary role, in addition to setting up the contract and making sure that everybody's covered and that we have good programmatic outcomes, is in monitoring those programmatic outcomes, and so that's a big part of our role. But I will, and so Ms. Inez, this is the presentation piece of it. Sorry. Yeah, switch back to the presentation, and Gina will walk us through our process.
Thank you, Director. As Director said, I'm going to present an overview of the lead grants that are in my office for monitoring and administration. The first one is the $13 million federally restricted ARPA award to Mount Sinai and the Lead Safe Coalition through Enterprise, and the second is the $4.9 million State of Ohio ARPA from the Ohio Department of Development through the Lead Safe Ohio programming to administer windows and doors repair and replacement program. We'll start with the $13 million ARPA to the Lead Safe Coalition, Mount Sinai, and Enterprise. It covers the service areas that you see on the screen, grants for property owners for lead safe home repair, lead safe certification incentives, emergency housing relocation for households facing housing insecurities due to lead, workforce development, and screening and testing. Here's the progress that the coalition has made thus far with this funding. The lead safe certification incentives are performing very well, exceeding expectations there. They're doing a lot of administrative back-end process revamping to increase efficiencies and set them up for success down the line. And this includes ongoing onboarding for home repair administrators from MECOS, Fairfax, and CMP. They're working to develop a pool of qualified lead-safe workers for home repair grant administrators to contract with for that work. They now have 23 lead-safe workers approved for use by grant administrators. And CMP has contracted to lead the lead safe workforce development programming. They have draft agreements with CDCs, and they're in the process of hiring lead clearance technicians for this work. As Director Margolius mentioned earlier, the screening and testing RFQ is scheduled for deployment this week. Here's a snapshot of the performance to date for these funds. 387 lead-safe certification incentives in the third quarter of this year brings the total to 3,852 total since the inception of this funding. They have 4 home repairs completed. And here you can see the home repair grants pipeline as it stands right now. 175 applications received, 10 scopes completed, 2 active repairs, 4 completed repairs. Here's an overview of performance to date for this funding minus the third quarter of this year until the official report comes in. You can see in the highlighted that the incentives are performing well, and in other areas, the ramp-up efforts are ongoing to bring this programming online. Here is the budget status overall. $6.4 million was dispersed to the coalition a little over a year ago. $295,500 spent in the third quarter of this year. Total spending of $2.9 million. They're at 46% spend for that original disbursement, leaving 3.5-ish million remaining. What are the next steps? We are working on a contract amendment, is now with law, to make a few changes to increase the efficiency and fund what's working in this program. The coalition would like to go from a $12,500 cap on home repair grants to an average investment per unit of $20,000. They would like to shift $1 million from the relocation assistance program to the certification incentives. And we're also going to include provisions that allow us to shift money into lead-safe certification incentives and home repair if the relocation assistance and screening and testing don't perform as planned. This flexibility keeps the funding with this important program and puts dollars where they're needed the most. Next, we have the Lead Safe Ohio grant from the Ohio Department of Development, which Director Martin O'Toole briefly touched on earlier. This is the $4.9 million award from the state of Ohio to provide lead abatement, lead cleaning, lead safe renovation, and supportive measures. Here's the overview of the grant allocations. CHN has $3.5 million of it. The contract was signed in mid-July. CD has $1 million to complete lead abatement projects. We did some equipment purchasing of SIAPS guns, and we have some administrative fees here. The CHN allocation, like I said, the contract was signed in mid-July. 2.8 allocated for lead safe renovations, $560,000 for lead cleaning, $140,000 for administration, and their goal is to do a minimum of 75 repairs. And here's where they are. We got some new numbers this morning. The city did advance them $250,000 for lead services for 5 homes. They are using, they're working from an existing pipeline, meaning that for this particular funding stream from the state, there is no open application process. Some updated numbers from the numbers here on this slide. They have 3 jobs completed, approximately $60,000 in spend, 14 in process with 6 nearing completion, approximately $424,000 in spend, for a total spend of approximately $526,000, meaning construction and administration rolled in there. Turning now to the $1 million in CD for lead abatement. Here are the allocations. $150,000 budgeted for Haven Home Congregate Shelter, $600,000 for homes with lead hazard control orders on them, and $200,000 budgeted to supplement repairs on existing HUD-funded projects within the department. For example, one home had a garage that tested positive for lead and was deemed structurally unsound and recommended for demo, and these OD award dollars made that demo possible.
Because HUD dollars do not get to don't allow you to get to the garage, even though that may be a need.
So here's where we are in CD. The five homes with lead hazard control orders are approved and in the pipeline for abatement. 2 of those are in scope writing with the help of the contractor liaison that the state provided to us as part of this award, and 3 waiting on risk assessments, as Assistant Director Scott spoke about earlier. And the 2 supplemental projects, supplementing the HUD-funded projects, are in law for contracting, as is the Haven Home project. And here is a projected timeline. I want to emphasize projected, and there are several contingencies here across the bottom of the screen. By the end of October, we'd like to see the Haven Home and 2 supplemental CD projects started. By the end of December, the 5 CD lead abatement projects with scopes completed and the 2 supplemental CD projects complete. And by May 2025, Haven Home complete and a continuing pipeline of abatement or supplemental projects ongoing or complete within CD. There was one more slide that just had an overview of the total award, the OD allocation, the CHN's $3.5 million, the city's allocation, $1.419 million, and the expenditures to date and the balances, and I can provide that to the committee if needed.
Yeah, I have this slide. It seems pretty critical to get it up there as well, and it was in what was sent this morning. So,
There it is.
look at that.
That's
That's text.
Okay. I can take you through it briefly. You see down the left side, you see the various components of the award, then the allocations that the OD gave us, and then the allocations going to CHN, the 3.5 total, and then you have the 1 million in CD, plus the equipment purchases, plus the administration, and then you have the expenditures to date.
And in closing, Chairwoman, again, I will reiterate, we are not where we want to be. We're very far from where we were, and we have a lot further to go. But I'm confident that by sticking to our strategy and actually implementing these programs that we've put in place, that in the next 6 months you will see a major change and shift in the amount of work that we're able to do. I want to thank the folks that are working on this every single day under our new Bureau Chief, Danette Davis's leadership. We have Camille Madison and Naomi Brookins who are in the room, who are doing the day-to-day work to see these grant dollars translate into safer homes for residents. Council members, what I would say in anticipating perhaps a question is in what way can we help? And it's in supporting all of the housing initiatives that you all have been supporting, and we hope that you continue to support. Again, the more new housing that we're able to do, the more home repair and home rehab that we're able to do, that directly translates to lowering the risk for children to be lead poisoned within the city of Cleveland. The best way to do it is to make sure that we continue our track of putting housing first and making sure that that whatever it is for housing is getting through, and that we're really putting all of our efforts into making sure we have clean, safe, and supportive housing for our residents and children.
Thank you very much, Director. I'll hand it over to Let's Say Cleveland Coalition to continue the presentations, and then we'll turn to questions.
Thank you. Good afternoon. Good afternoon. Wake up, everybody. Here's all what you've been waiting for. No, it's just been a long, nobody's had their sugar and lunch and whatever. Good afternoon. I'm Ayanna Blue Donald, Vice President and Ohio Market Leader for Enterprise Community Partners. And to my right is Wynette Shears. She serves as Program Director for our Lead Safe program. And just because everybody's been waiting, and I know that I have limited time and I talk fast, but if you are an administrator or a part of the coalition, if you can just wave your hand, I appreciate that you've been here and part of my staff is here. And just thank you everyone for being here. No. Being here all morning. Thank you. We are proud representatives of the Lead Safe Cleveland Coalition, a coalition of over 500 members from every sector and walk of life. While we are from different backgrounds, we share the guiding belief that no child should be left lead poisoned in our city. We're happy to be here. Once again, seems like we haven't been here in a while with the city and our CMHA partners, et cetera, and council. Just really thank you for having us here. Thank you for letting us have the opportunity to speak. Before we jump into the presentation, I kind of wanted to reflect on the coalition and City of Cleveland and community really coming together, how this thing really started, because as you know, there's been a lot of discussion in the news about furthering collaboration, but just bring you back to where we started and how we got here really quickly. To really do something that the City of Cleveland has never done before. Councilman Starr brought up, we've been at this problem from 1978. That was the year I was born. So we've been at this for 46 years. Instead of using Cleveland's children as lead detectors, we created a proactive lead safe certification system which transformed the way things were done. We approach this from a systemic approach and level and change that needs to happen. This system includes both carrots and sticks to support compliance, and we all agree we need both the carrot and the stick for this system to work. This coalition is a collaborative movement bringing together public, private, and philanthropic partners, including organizations, city officials, lead professionals, policymakers, and community members, a lot of which were in the room and still are in this room today. Together, we work to develop a solution that the city could implement, backed by the Lead Safe Home Fund to make properties safe for everyone. This process was centered on community leadership, elevating the voices of experts, advocates, and residents who have been living this work on the ground for years and even decades. From the beginning, the policy committee of the coalition engaged in open dialogue, meeting for months to carefully weigh options, analyze data, discuss the practicality of what could be realistically implemented and enforced. While some of those ideas did not move forward, we focused on those that could have a tangible impact. In 2019, we had a very public hearing, as some of you all were at. You were there, to review how the law would work, who would be affected, and how it would protect our community. Careful balance has been struck along the way of what is aspirational and what is practical. Pervasive problems require bold solutions, urgent solutions. This is where we are now. Yet policy crafted without vigilant regard to feasibility, enforceability, and equity could, in fact, complicate our lead poisoning problem rather than address it.
That's true.
Just as we were gaining the momentum, the pandemic hit, disrupting the rollout and forcing all of us to pivot quickly, both on the private side and in city government. The coalition adapted with resilience, adjusting our approach in real time to meet the shifting needs of the moment. At every step, we have still remain committed to ensuring our changes and pivots align with the priorities of our funders and the goals of the city and the needs of the community, keeping our mission on track. We increased the amount of incentives available for both lead-safe and lead-free certificates, making it easier for property owners to take action. We expanded eligibility by increasing area median income. I'll talk a little bit more about more that we've done. We've broadened the list of eligible repairs. Yes, windows and doors are covered. Beyond programmatic changes, we stood up for Cleveland residents. We rallied against statewide legislation and House Bill 280, which threatened our local process, and we supported the Residents First legislation. And throughout all of this, we asked for feedback and we listened. We heard from council members, the public, the media, practitioners in the field, and our funders. We took that feedback and we worked to improve the system. When I say we heard you, I'm not just speaking to the council members here today, I'm speaking to everyone. The public, the media, the practitioners pointing out our flaws in the systems, the funders who believe in a path forward for a lead-safe Cleveland, and our advocates like Spencer and Clash. And I do read the newsletter, and if you aren't on his newsletter, you should be. Thank you, because it has great information every Sunday. Sometimes it seems like we are on opposite sides, but really we are not. We are all at this table, and we are all fighting for the future of our city and our children that live in it. It is imperative that everyone I mentioned, that includes you, work collaboratively as we move together. In the words of a great American poet and philosopher, Sean Carter, no one wins when the family feuds. We need to work together. To the slides.
That's Jay-Z council members.
If you don't know.
Also known as Beyonce's husband.
Yes. Just in case you didn't know.
He did chuckle. He did understand.
Thank you.
Beyonce's husband.
So, briefly, I'll just reintroduce you. Everyone knows, everybody sees us because generally I'm the person, or Wynette, she leads this work of who leads the Let's Save Cleveland Coalition, but we're really led by the steering committee. Enterprise is a paid partner in this, in the sense of we execute the work, we hold contracts, but the Let's Save Cleveland Coalition Steering Committee is really who makes up the decisions and decides how we're going to spend money, helping to assure the coalition is viable with its mission, strategic guidance, the representative voices of the coalition. So I'd like to reiterate, as we talk about funds and our programs, all of those things come approved through the steering committee and not just myself. We proudly convened this Let's Save Cleveland Coalition. Here are a few of our programs. When we say the Let's Save Home Fund, we are referring to all the resources, programs, and services our city needs to make the lead safe certification process feasible and successful to prevent lead poisoning. This fund is supported by over 20 funders, including the city, including the federal government, including the state. As a quick reminder, the fund includes grants and loans for property owners, workforce development, community education, support for families, and lead safe childcare, and recently added relocation assistance, and we will soon add lead screening and testing, as Dr. Margolius alluded to earlier. This work is led by the administrators for the Lead Safe Resource Center is EHW, the Lead Safe Home Loans and Grants are CHN Housing Partners, Fairfax, Famicos, and Cleveland Neighborhood Progress. Starting Point is the administrator for the Lead Safe Childcare, and EHW will lead our relocation assistance. Now to the money, to the budget. When we originally set forth in the Let's Save Cleveland Coalition, we set a 7.5-year budget, which ranged from July 2020, in the thick of things in the pandemic, and to carry us through September 30th, 2027. Currently, we are in year 5 of the 7.5-year budget, so you can see that timing. The funds that were originally committed were $112 million. The funds that are currently committed are $92.8 million. You will see a decrease because we had $19.2 million allocated to a loan fund for a variety of reasons, which we can talk briefly about later and welcome questions about this. The loan fund did not deploy, as has been, did not deploy. We did not find an interest in our loan fund. When you look at the average home cost on our east side of Cleveland, it's 51 about, Frank Ford has said as of last week, $1,000. If you are an owner of a $51,000 home, you are not incentivized to take out a loan, especially you have so many grant dollars available. You also aren't incentivized and pushed in the sense that, you know, it has not deployed. We have scaled that loan fund back to $1 million, and that's what we aim on implementing. I will also say that there have been other loan funds across our state, namely in Toledo, Lucas County, Cleveland and Cuyahoga County, that Huntington with OFA has administered, and they have found the same problem. This issue is not unique to us, but really indicative of our housing stock and the desire for people to make their properties lead safe. You'll see here dispersed through year 4 are dollars as far as lead safe incentives of over $3 million, lead safe loans of around $50,000, and lead safe grants of $3 million. When I also mentioned how many dollars we have committed, we have about approximately a third of that amount that we've actually have seen and received. So there's also a misconception that there are $112 million sitting in a bank account either at Mount Sinai, United Way, or Enterprise, and that is not the case. This is evidenced by our funders have made commitments of how they want to fund Let's Save Cleveland or the Let's Save Home Fund. but we've received about a third of that $92.8 million. And out of that, we've dispersed about half of that. So you see the dollar amounts for incentives, loans, and grants, but there is a huge amount that has gone towards marketing and our administrative costs and our, as Dr. Margolius also mentioned, we have billboards and bus stop ads, and we do a lot of community engagement and workforce development, and those numbers aren't reflected here. Yeah, Lead Safe Loans was the amount of dollars that was loaned. So in the sense that we had two different kind of financial products. One were grants that people would not have to pay back, and the other were loans that people would actually have to pay back. So what we found, CHN Housing Partners is the entity that administers the loans, and what they found was essentially when a scope was conducted on a person's property, they either for some odd reason they didn't qualify for a grant or they met the maximum and there still were needs, people chose not to get the loan. They said, never mind, I don't want to do it. I don't want the loan. So that's that answer. Yeah. Did I skip a slide? Nope. Okay, moving right along. City of Cleveland's Lead Safe Home Fund investment, I want to highlight that general fund revenues in the very beginning, for those that were there, the City of Cleveland invested $5 million. That's administered by CHN Housing Partners. Those dollars were given directly to CHN. $3 million for grants and $2 million in a loan loss reserve to cover the loan loss for those loans that were mentioned. And then $13 million in ARPA dollars. So the Lead Safe grants, we feel that we will be on track. We see a significant and sufficient amount of applications to meet our ARPA goals. Our Lead Safe certification incentives, as Gina mentioned, has been performing very well. Emergency housing assistance relocation, that is a new award for that RFP that we issued it twice. And so our current administrator will be Environmental Health Watch. We are asking the city for pending amendments for $1 million to go to relocation assistance. Keeping in mind for this is a pilot. This was at the request of the Housing Advisory Board, or the Lead Safe Housing Advisory Board, I think is the technical name, to actually have housing assistance. So earlier when it was asked of CMHA, like what happens if somebody has to move out of a property, et cetera, these funds will be available for everyone that faces a lead hazard, or lead hazard control order, lead remediation is happening in their property. Their landlord's supposed to do repairs and they just haven't done it. We can talk about it a little bit later, but we think that this will be pivotal in helping people get out of properties and units that maybe they feel like they're stuck because they don't have the resources to leave. The ARPA dollars also covers workforce development and a screening issue later on this week. And then we have one other change that was mentioned that I really want to highlight. It's changing from a $12,000 cap for our grants to going to an overall program average of $20,000. We have found that, of course, properties that we walk to, which has been mentioned, we walk into have a huge amount of repair that needs to happen, notwithstanding lead safe repair. We have had properties that are on hold essentially because they are well above the $12,500 limit. So instead of using a $12,500 limit, we aim to use a $20,000 overall grant cap. So that means one property may have $8,000 worth of repairs, another may have $40,000 worth of repairs. As long as we keep our overall funding at a $20,000 per unit average, we are still pushing forward. So in essence, I don't want to say there is no cap for grants, but if we go into a property and we see the need as a certain amount to make a property lead safe, then we will proceed as long as we're well within our overall grant dollar cap. All right. Our Lead Safe Home Fund investment, just the metrics, I think that's already been covered maybe just slightly by Gina, but you see that these are our metrics, at least for the ARPA dollars that we have before us. And I know you have these, so I'll keep moving because time is ticking. The screening and testing RFQ that we aim to issue this week, we're really excited about it. We're seeking an administrator for a critical new program to increase the blood lead testing rates in the city of Cleveland, so the timing couldn't be any worse or better, really based on the data. The selected administrator will spearhead efforts to expand and strengthen lead screening, testing, and early intervention services for residents of the city, focusing on the city's most at-risk populations. We already know what the data has showed us. but the RFQ and the administrator will oversee 3 core programs: improving community-based lead screening and testing, streamlining lead safe education training, and collaborating with public health authorities. Next is relocation assistance. I spoke briefly about relocation assistance, but in the last quarter, through a public or RFP, a really public process. Everyone we pick for everything, it does go through a RFP. The steering committee chose Environmental Health Watch. This is the second time, as I mentioned, that we issued this proposal. Currently, our system, our community really has no place for families to go, and so we hope and aim that families will be able to go and turn to this. We really don't know what the true demands or needs are because there hasn't been a system like this before, and so that's why we are really proposing $1 million to be spent towards this. This is also why we're proposing for flexibility in the ARPA contract, because if we see that the demand is not what we think and anticipate as we continue to march forward the ARPA deadline of 2026, we hope that we can reallocate these dollars towards other needs that are proving to be outpacing essentially the dollars that we have assigned. So in addition to the coalition stipend that I kind of briefly mentioned, we will also have a master lease with housing providers. We will rent 4 units in all geographic areas of Cleveland. Well, not all, in the 4 kind of quadrants: northeast, southeast, southwest, and northwest. So this will give the opportunity, if you don't need a stipend and you just need someone to temporarily stay for 3 days, that we could have a space available for you to go to in those days while your property is being remediated. All right. Now I'll turn it over to Wynette.
Thanks, Anna.
I know. I know.
Okay.
I don't know what
Yeah,
time it is. Yeah.
I'll do my best to hurry through this. So from the beginning, the coalition has offered lead safe certification incentives for property owners that needed to comply with the lead safe certification. And so what you see here on the slide is the modifications to the program. So originally, we had a smaller amount that individuals could receive, but recently, well, actually about over a year ago now, based on feedback from partners as well as property owners, we increased the amount of the lead safe certification incentives as well as the maximum per property owner. We also are offering $1,000 incentives for folks that are complying with the 20-year lead-free standard. There are incentives available for second-round certifications as well, so I did want to mention that. This is just a slide showing the incentives awarded per year. I'll move past there since we are low on time here. And then here, just as a reminder, our loans, grants, and incentives. So we are focused on an interim control improvements and repairs utilizing Lead Safe and Lead Safe Plus model. The general eligibility is just a property has to be built before 1978, and the property owner has to be in good standing with the rental registry or have paid their fee for rental registry and current on all their taxes and or have a payment plan in place. On this slide is just sharing a little bit about the grant details. So we are offering grants for for-profit owners, rental property owners, as well as owner-occupied property owners to remediate their properties. Someone can receive up to 12 grants, though only 1 grant per unit. And then here is the eligibility criteria that Ayana mentioned earlier. One of the things that is important here is that despite someone's income, they are eligible for at least $4,500. Won't cover this here since we alluded to this earlier around some of the modifications that were made to our grant program. Here is just describing the Lead Safe and Lead Safe Plus standard. One of the things of note which was mentioned is that we are operating on a Lead Safe Plus standard as well as a Lead Safe standard, meaning that if there are issues in a property that can't be sort of painted over or remediated, we will replace those things. So windows, doors, those things are included within our program.
And this is just a chart that shows what those examples look like as far as the Lead Safe model versus the Lead Safe Plus model where we're replacing things. So wanted to just share a quick update on our grant process, or in progress rather. So as Anna mentioned, we are working with CHN as well as some new additional grant administrators. So really excited to report that Famicos Foundation has remediated 7 units. And then here's just a pipeline snapshot of the units that they have in their pipeline. And then as well, Fairfax their projects are commencing, and you'll see for both, for Fairfax and Famicos, the goal here is 60 units per year. And in part that is due to some contractor issues, which we've heard already earlier today. And just to give a quick update on the work that Cleveland Neighborhood Progress has done so far. So as was mentioned, we're partnering with select CDCs to provide grants. There's contracts that have been executed with a number of CDCs already. So Northwest Neighborhood, Slavic Village, Union Miles, and then there's several other contracts that are in final review that will be coming on board. And then you'll see even beyond that, there are a few other CDCs that should be joining early 2025. But the goal there is to remediate about 244 units over the period, over the year 5. And then also for workforce, as was mentioned, CMP will also be bringing on clearance technicians that will be available to provide free clearances for property owners that may need them in the community. Next, I'll turn very briefly to the overview of home loans and grants progress. While we look at these numbers, I also want to reiterate, I've mentioned a systemic change. So we have our CDCs that are involved in this process. As you all interact with your CDCs, you know that they've kind of lost that muscle to do robust home repairs. Some have done it, some have not per se. We're being very realistic in the sense of we're trying to create capacity at CDCs to continue this work, to do more of this work in the community. With that being said, moving on to what we have in the pipeline. We have over 1,000 applications in the pipeline. I really want to highlight this number. For the first couple of years of the Let's Save Home Fund program, we had very slow uptake and very slow applications into the system. Last year, CHN Housing Partners sent out a mailing to, part of the reason CHN Housing Partners has been at the table so they can leverage their other programs. They sent out mailings to their other programs, so their HEAT program and their other home repair programs that I also would like to asterisk that generally those are owner-occupied homes. They received an influx and inundation of applications in the mail as a response to the mailing that they did, which has created an influx and overwhelming demand for our grants. I will mention that out of those applications, the majority of those applications are actually owner-occupied applications and not properties that are owned by landlords. I want to make that fine distinction because we have had to pivot to prioritize properties that are rental properties and where we have noticed at least that children are located in those properties so we can make sure that we address the applications in the pipeline and the backlog. This is also why it's important we have brought new administrators to the table, but quite frankly, our new administrators also have limited capacity, where Fairfax and Famicos essentially are saying they can do about 5 properties per month. That's about 60 per year, because this is the capacity that they have. This is how many contractors we have out there doing the work. When every time we have issued our RFP, for instance, the latest one for grant administrators, we've accepted everyone for our grant administrators that come to the table. There are people out in the community that don't want to touch lead at all for a variety of reasons that I'm sure Councilman Harsh could explain because of your experiences. But I do want to highlight how many projects that we have in the pipeline, and we are ever looking for ways to improve the way that we can deploy dollars. There just aren't enough people out here that are willing to do the work, that have the capacity to do the work. We were fairly ambitious in the beginning of this to say how many properties that we can do, and we were faced with the harsh reality of how many contractors are out there, how long it takes to turn a property, and how long, and how many contractors are, quite frankly, out here willing and able to do the work. So so the Lead Safe Resource Center, for most that already know, it's our one-stop shop for lead poisoning prevention. They're on the ground, out in the community, educating people about lead poisoning prevention, how they can prevent lead poisoning, and then also offering workforce development as well. Won't go through that. Here's just a slide that shows some of our workforce progress, the number of classes that we've held, the number of people that we've trained, and then some of the most recent workforce progress, such as establishing the Resource Center, or EHW, as a local testing site to reduce barriers for people being able to test and become certified. I'll move on. If there's questions, we can come back to this. And then here is just some additional updates on workforce development. One of the things that we found that was important was to split out the RRP trainings. Initially, we were having the property owners in the same class as the contractors. There is some efficiencies that was able to be created, as well as specialized sort of training when separating those out, and so we've done that. And then, as was mentioned, we are constantly looking for lead safe workers to join our workforce, and so we have an open RFQ out. Actually, we're accepting applications on a rolling basis to allow people to work within the programmatic areas of ARPA and then our ODOD funding. And then this slide here is just showing some of the Resource Center progress, number of calls received, events attended, as well as property owner engagements as well. So this slide here just shows the hotline calls received per year. So you'll see that at peak volume there was about 66,000 calls in 1 year that they fielded. And then also just wanted to touch on Lead Safe Childcare. As was mentioned, we are partnering with Starting Point to administer Lead Safe Childcare. This is a pilot program that we're looking to scale, but essentially we're looking to define what it means to create a lead safe childcare space, and then this will be a model that can be replicated. So we're really excited about that. We've started out with one cohort initially with 6 providers, and that work has started. There has been initial construction management starting on 2 childcare facilities, but we can always come back and share more updates there. And then just a few ways to stay engaged. The Resource Center outreach team is always looking for ways to stay engaged. As you all know, they're excited to come to events that you're having. So if there's anything that's coming up, please let us know. One of the things that came up earlier was about what are ways that you can educate the community about lead poisoning. And so one of the things that came out of our committee structure was that there was a need for a streamlined toolkit that everyone could use, so that we're all community-facing workers are saying the same things to property owners and or families, because there's a lot of confusion. And so the coalition, in partnership with EHW, worked to create this lead education toolkit that has been rolled out, and really excited to share more about that. And you can find out or sign up for training on our Let's Say Plea website. Also, there are several community conversations that we are hosting this in October. 2 of them have already passed. There's another one this Wednesday, and then the final one will be during National Lead Poison Prevention Week, and Council Member Conwell's neighborhood in Glenville this week is at in Slavic Village. And then lastly here, just want to make a plug for National Lead Poison Prevention Week, which is October 20th through the 26th. There's a lot of events happening throughout the community, but want to just point to our lead walk and rally that's on Saturday the 26th from 11 to 2 in the Glenville neighborhood. So if you are available, please join us. Last but not least, we are so just thrilled to actually be here. It feels like we got 17 minutes, and I'm sure there's a lot of questions. But we also felt like, thank you for giving us a little bit of time to rush through, because there's always a lot to update. I think a lot of people think about us as just like in really one way, when we have so many things under our umbrella. And there were actually so many other things we could have talked about today that we didn't. What I would like to highlight is that something I mentioned earlier, that I think we really need to embody the spirit, and it's here today, that working together, the policy committee is kind of where it all started, right? And Councilwoman Moore, I know that you were there at that stage in the very beginning, and people in this room, I really hope that we can see a robust turnout at our next policy committee meeting on October 30th. That should be at noon. We welcome everyone. We welcome everyone's opinion. Yep, at noon. We hope that the city administration can join us to discuss and share a little bit more details about their plans to engage the community and implement this process and their proposed changes that works for everyone. I feel that if we work together at this, that our lead safety efforts and, making our properties lead safe and or lead free can really work to save our children. So I'll conclude on that note. Thank you.
With Glenville, I know we're there. You have the flyer for the Glenville event? I know my people are walking, and that way they can pass it out now. I was there when we put it together, but I have so many events. We're doing it on the 26th, right?
The wall?
The wall.
Yes, I have flyers. I'll give them to you. Yes.
Okay, good. And I think my band is playing as well. Are we playing?
Yes.
We're playing? Oh.
You're supposed to be there playing. You go.
Man,
To the chair.
20 freaking events this in October. It's been a ton of, but we'll do it. We're gonna do it. We'll be there. We said we're gonna be there. We'll be there, even if I go.
They're gonna wonder where you at, Councilman.
I know they'll beat me up and call me and everything. I don't want my phone blowing up. You were good as a director here too. When I see you, I always think about that. You're very good. The other one we have is good also.
She is.
But I used to walk in and see her at any time, and I would get help for my residents. The director, the one I'm looking at her like that. I just walk through and see her. Is that true? Even on a Sunday,
I plead the fifth.
Even on a Sunday, I could call and get things done. We had a house explosion on 125th Street. Before I got there, the director was there helping me out. She's smiling. She know. But, any questions? All right, Vice Chair.
Thank you. And I've also I've reached out to the council president with the hopes that we can get a little bit more time. This is such a critical issue for the city. I don't want these last few stages to feel rushed, and especially given the time that's been taken out. I hope. Yeah. I'll see. He says he's going to be here in a minute, so hopefully we can work that out, because I know many of my colleagues will have questions as well. But I'll try to go through some key highlights. So the first, I'm going to start with CD because you all presented first. You in talking about the HUD grants, there was a time when, because of well, let me preface by saying this. Across the board, we are not spending our dollars fast enough to get them into bricks and sticks, to get them into homes. I'm going to come back to that again and again and again. Director Hernandez, you said it. Assistant Director Tony Scott, you said it as well. So I think that is a shared agreement across the table. We have not been spending dollars into bricks and sticks fast enough, but I want to get sort of a sense of how we're doing and where we're going, because we've heard this song for a little while now. And so in terms of the HUD grants, there was a time when HUD had flagged these grants and the failure to deploy the dollars with essentially like a flag color rating. My understanding is for a time they were yellow. At least one of them was briefly red. Could you give us the current sort of flag rating for these two grants with HUD through the chair?
To the chair, to the councilwoman, unfortunately, the last reports which I provided to council indicate red. So we have a upcoming memorandum due to our HUD monitor, Miss what's her name? Ms. Williams, sorry, as well as ongoing communications with them. So one of the particular things is trying to expand the reach of the high impact grant, as the chair knows, the Glenville grant, so that way we can be more expansive and more fluid in deploying to the hot spots, if you will, such as what we saw in Director Margolis's presentation earlier today.
Thank you. So it's not just us that thinks it's slow. The Housing and Urban Development thinks so as well, and you are actively working with them on it. Turning to the ARPA allocation, we gave $13 million to the Let's Save Cleveland Coalition, but it was initially $17 million, and we pulled back $4 million for work within the city. Gina, I don't know if this falls within your department, but could you remind us where that $4 million was going? I believe some of it was to law, and where the spending of those in-house dollars here within the city. Through the chair.
Director?
Those dollars went in a multitude of places, and I'm trying to get off the top of my head where where those are. I
To
know
the
that
chair,
we're
are you
using
referring to
some
the-
of them for those high-end repairs.
Okay.
That go above the threshold of HUD dollars, which I think at the time was about 12,500 was the limit. I believe that we got that limit raised. So one of the things that we're doing when we're talking with HUD is we are saying, how can we expand to make this grant work? So they are helping us to be more adaptive. So for example, for the Glenville grant, there was a very specific place where that could be spent, and you could live across the street from that and not be able to get any dollars. We were able to advocate to our partners at HUD that we needed to expand those dollars. I will track down the exact rest of the balance of those dollars, but I know that was the intent of some of those dollars were to cover those projects that were above the limit.
Thank you. I do recall that, and I also recall some amount being set aside for the law department to be able to hire additional prosecutors. Do we know if that was completed through the chair?
I believe that is the work that Dave Roberts is doing, and so that would have been covered in the building and housing section, that part of the presentation. So some of those dollars went to support that, and I know that they have been working diligently.
Okay. Well, I think those are hard ARPA, so I'm asking in the administration, I'm looking over at our departments, Director Margolius as the MLE for the day. Could you please make sure that we get a report back about the balance between the 13 million and the 17 million and how it's being spent within the city? I next want to turn to the incentives, which on paper are absolutely a bright spot and have been sort of a continuous source. Well, they have been spent. They have been money that we can get out the door in contrast to some of the bricks and sticks work. And just so everyone knows, I mean, this is a check. This is cash in hand for a landlord who completes the lead-safe certificate or gets a lead exemption. But one thing that we've learned on the Lead-Safe Advisory Board and working with Dr. Rob Fisher is the variance between multifamily units that are complying and single-family duplex and 3-unit properties that are complying. Have we broken down those incentive numbers by the type of housing and seen how much of that money is getting into small landlords' pockets versus large apartment complexes? Through the chair.
Through the chair to the councilwoman, I'm not sure if we have that readily available as far as, I do know off the top of my head that there's over 900 unique property owners that have received the incentive dollars. I don't know where it breaks down. I will say that also the incentive dollars has actually been, I believe, strongly driven by the practitioners we have in the field, because there are practitioners that are out and about. This is their business model to go out and conduct these tests. And I think as part of them conducting the lead clearance exams, they're touting, hey, you can get these dollars and these free dollars. So I think that has been a push of why those dollars have been spent as well.
Yeah.
I don't know the typology. Keep in mind that these are only, of course, available to landlords, not owner-occupied, because owner-occupied owners don't get the lead-safe certificate, so they wouldn't be eligible for this.
Yeah.
So it is all rental properties. I don't know what the breakdown is. So if we can ascertain that, I'll go back to the administrator and ask.
I think that'd be worthwhile to
Yeah.
do, just to, especially as we're talking about the 1 to 3 family unit and making sure this is getting out into the field. With that in mind, I also want to spend a little bit of time talking about the overall budget for the Lead Safe Cleveland Coalition. You provided on the slide, I believe it's page 4 on this one, out of the 92.8 million, you provided the sort of what I'm calling the bricks and sticks, the amount that's physically gone into properties or directly into landlords' hands, which is about 6.2 million across incentives, loans, and grants. But can you confirm through the chair the total amount that has been spent by the coalition through year 5, year to date?
I don't know the number through year 5, year to date, because we haven't received disbursement requests. So generally, we act on a reimbursement basis. So we're still doing that accounting and haven't received that from all administrators. So through year 4, it's about roughly $30 million, I believe, nope, that may be wrong. That's not true. That's how much we have received. It's about $14 million that we have spent. So
I
30
apologize. So I'm so sorry. I want to make sure I really understand that. You're saying you've spent about 14 million or 14 million?
14.
14. And out of that, 6.2 million is in bricks and sticks.
Yep. And so the rest is marketing and insurance. For instance, we at some point found that insurance was a barrier to our contractors and to our administrators. So we purchased an umbrella policy for everyone. So that would not be a barrier for contractors coming to us to say, hey, I don't want to spend $5,000 on insurance. We purchased an umbrella policy for everyone. So there are tons of things that are embedded in the rest of the dollars that are spent.
Yeah. Well, I just want to make a note of that because that is a surprisingly low number to me. And it is out of a $92 million budget. We're into year 5. And we know we've been struggling to spend the dollars to get it out into homes. And of course, I have concerns about the ratio, right, of bricks and sticks to administrative costs. But I just am reflecting on that because we haven't gotten those budget numbers in over a year. And I was pulling up the last time you came to council to present was in February 2023. And just to confirm, at that point through year 2, you'd spent $6.5 million. And the anticipated 3-year budget, the anticipated year 3 budget that you presented to council was $19 million on that day. And so through the chair, I just want to confirm we certainly did not meet that expectation of spending $19 million in year 3 of the program.
Through the chair to the councilwoman, that's correct. The vast majority of any of our budget, actually, the dollars that have been committed, the dollars we have received, those are set aside for grants. That's what most funders want to spend those dollars on. It's actually not the admin costs and not the marketing and not the other things. And so, as mentioned, and I think as evidenced as well, I'm actually kind of glad that CD, well, you know, love you guys that are sitting at the table with us today. But it's shown as their deployment of their HUD dollars as well. It is very hard to get the dollars out the door. When we first started this, of course, I was on the other side of things, but the coalition contemplated in that sense. I think that the goals were definitely lofty as far as how many units could be actually serviced a year. That has not been a reality as far as the numbers that were anticipated. So when you think about those budget numbers, that's the numbers that our administrators give back to us to say, yes, we can do this amount, and that has not proven to be the case. In the very beginning, our demand just was not there, quite frankly. In the beginning of the pandemic years and a little bit after that is even evidenced by the phone calls. It's evidenced by the other incentives, that went out the door. The demand just has not been there. So now the demand has picked up in a certain way when we open up the door to owner-occupied homes, et cetera, but the demand still is not quite there to meet even like a $19 million budget for rental properties, despite all of our efforts and however many thousands of people we've reached the community engagement and hundreds of events out and about and radio ads and you name a thing, social media that we've done, that there is still a level of apathy in our community, quite frankly, for wanting to make their properties lead safe.
Yeah. I appreciate that. I think we share a frustration across the table of having, you know, the headlines of this money committed and then struggling across the board to spend it. I mean, and there are the smart people at the table who are dealing with the problems with the contractors and dealing with the pipeline. You know, it's clear that there are barriers, and yet, like, this is the work, and it's been years now, and we haven't, and it's been, okay, we're on the cusp of moving, we're on the cusp of changing, but, you know, actions will speak louder than words. We're going to have to see where we're at. But, you know, certainly I know you aren't satisfied with it. I know you aren't satisfied with it. I know I'm not satisfied with it. I don't think anyone here is. But I just really want to hit home how much we are struggling to get this money out the door. You see those headlines, and then it's $3.5 million has been spent in grants into properties across the first 5 years. And that's the same amount that the city's trying to spend right now, and it's a drop in the bucket regardless. So I realize we're short on time. I'm getting on my high horse. I can feel it, but I will yield my time back to the chairman.
Mr. Chairman.
It's in the
To us, Director. I'm going to yield in a second.
Mr. Chairman.
But, and I'll yield, give me a second.
Oh, yeah, I think it was just 2 numbers that aren't on the slide.
Right. But you narrated the budget off the top of your head. You know, can you send it to us?
Well, yeah,
Don't
so
just
as
give
far
me
as the
two
ARPA
numbers.
budget, to the
Right.
chairman, I think that this community development has all of that information, and so they can provide that to you. As far as the overall $92.8 million budget, some of that is, our funders, so are protected
got
by
you. I
what they
got you.
want to
Yeah,
release,
yeah,
et
yeah,
cetera.
yeah, yeah.
So that is, their information
see.
necessarily to release. Again, I like a gentle reminder that people see me all the time here as an enterprise representative, and it is not just me that makes the decisions as far as what happens, how money is spent. Quite frankly, how our budget is deployed and what those dollars are spent on. It's a bigger, broader thing. I will add that as far as transparency is concerned, Council President Griffin is on our steering committee, and Emily Collins, I think senior strategist is her name, also sits on our steering committee. So there is that level of interaction with both council and the administration to sit on the steering committee to be able to weigh in and hear and know that information as far as the broader coalition and what's behind it.
Okay, I got you. He sees your funding streams, Council President Blaine Griffin.
Yeah, and Emily Collins.
Right. And then that way
And all of our
I'll call him. He'll
contracts,
tell me.
RFPs, et cetera, go before this body
Mm-hmm.
for approval. If anybody on that body wants to participate in our RFP process, review, they do. For everything that's administered through community development, actually, Gina has, as of late, been a participant in that. Any contract that we sign using those dollars actually has to go through their department first for final approval, et cetera.
Okay, they have oversight.
They do.
Let me yield to my. We'll do Chris Harsh, then I'll yield to you, Councilman.
Thank you, distinguished chairman.
All right, thank you.
Mr. Chair, I think I want to climb up on Councilwoman Moore's high horse and take over that seat for a little bit longer because, and I mean no disrespect, I believe that the $3 million from the original 17 that was clawed back from Mount Sinai for community development, I believe 153,000 has been expended, 346 is encumbered, and 2.5 million is still pre-encumbered. And if I'm correct, Mr. Chairman, those are hard ARPA dollars that all need to be encumbered in the next 2 months. Or I don't know what the penalty is if we don't spend hard ARPA, but I'm pretty sure it's not good and we lose it. And that would be an absolute crime. And I believe, Mr. Chair, that the law department is sitting on 952,000 pre-encumbered dollars from that same 17 million that was reduced to 13 and has only expended 47 million. And of all of this, actually, Mount Sinai is doing is getting the most money out the door, having, I believe, expended 6.4 million, but that might have been because it's transferred to them through the law department's actually putting it in their account, maybe not the money actually getting out into the community, but then they still have 6.5 million encumbered. At least that's been encumbered, and I think that meets hard ARPA requirements. I'm very concerned about us losing this. We talk incessantly in this city about being one of the poorest big cities in America, and we have the opportunity to put money into our housing stock to make it safe. And as Dr. Margolia said earlier, we have to swim upstream and make homes lead safe so the kids don't end up getting poisoned. And this is our moonshot to do that. This is our chance to put those funds into those homes. And I'm concerned that we're not making the necessary efforts to get that money into the community. Mr. Chair, when I was a community organizer in your neighborhood,
I know you was in my neighborhood.
predatory lenders were going door to door, knocking on doors and saying, do you want me to get you new windows? I can get you new windows, and then making people refinance their house in order to get new windows. Yet we can't knock on those same doors and say, we can just put new windows in your house for free? We have the money to just put new doors, new windows, to go in and clean houses, and we can't door knock the same way predatory lenders door knocked? By all means.
Through the chair to the
I want Hernandez to ask first, because, with this money, because he's looking at constraints. If he mentioned 2 months,
I'll have
then
to.
you.
Through the chair, I'll have to look exactly at those numbers. I want to make sure that we're all looking and talking about the same dollars. So I will follow up with a report on exactly what dollars are out, what dollars are, at risk, if there are any dollars that are at risk of not being spent. But I'm happy to do that. I don't have that with me right here at this moment.
Mr. Chairman, I am scared that the people who had no shame in ripping off this city put more effort into bankrolling their own well-being. They put more effort into ripping off this city than we are putting into helping the city. And I mean no disrespect to the people at the table. I know you're just sitting here right now to have this conversation with us, but I am definitely concerned that we are not putting the effort in there. We should be canvassing every single household in Glenville, Mount Pleasant,
Glenville.
Fairfax. We should be going door to door in these communities saying, do you need help with your house? Do you need help cleaning your house, fixing it up, making it safe? Do you know what lead poisoning is, where it comes from? Can we invest in your house for you, on your behalf, at no cost? And we should be unashamed in doing that with armies of door knockers all throughout the east side of Cleveland, where the biggest problem is. And I'm afraid if we don't do that, if we don't have that level of effort and urgency, we're not going to spend this money.
I want to make a point. I just want to make a quick point. I don't deny what my colleague just said, but say the least that I know that I have worked with Enterprise and also the resource center. That is a lot of homeowners. It's a lot of homeowners that I have met in Ward 4. They are afraid to expose their financial information, and this is why they have not. This is why they have not, proceeded with this grant. I have called the resource center. I have got the representatives out into the community, and these homeowners, a lot of them, will not expose their financial, information to get the grant. So that's a problem too. Just say the least.
But
Understand that.
That's
All right,
a
I'm just.
problem, but I don't want to lose no money. I don't like losing money. Losing money not good.
Through the,
So we're not going to let you, we'll let you cut in.
Just got a comment, and it's really quick.
She was going to respond. With all due respect to the chairman, could Ms. Blue respond to my point?
Right, Jeff. Let her respond. Oh, no. Director Blue? I don't have a problem with Director Blue? Director? No.
I just have a question.
No.
through the chairman to the councilman, really quickly, I don't think that the issue, quite frankly, at this moment is an army of door knockers and doing community engagement. The issue is the need for contractors to actually do the work. I am so looking forward to seeing the outcome and the progress of the implementation vendor that community development has started. I've been in talks like, how does this work? How does this happen? Et cetera. Right now, if I look at Famicos and Fairfax, who are the ones on board, if they are saying they can do 5 a month, that is not because we have a dearth or a lack of applications in the pipeline. It's because there is a lack of contractors that are able and willing to go out here and do the work. So that is where we are at a nexus point right now as far as deploying the dollars, is how many contractors are actually out here and willing to do the work. I just needed to get that point to the chair.
Fair point.
Say something before,
Very briefly,
Yeah,
Mr. Chairman.
Councilman, yeah.
Thank you, sir. This is such an important subject matter, and the last 2 presenters have done a wonderful job in making presentations. And I don't want it to be lost at this table. I would suggest, my humble suggestion, Mr. Chairman, is that we continue this up next week, because there's just too much stuff and I know I got a litany of questions. I think Rebecca Maurer started out with with hitting straight to the core, and I just think that we need more time at the table. So my suggestions, humbly, would be let's continue this, because we're going into the Finance Committee right now, and I just think that this is an important
we will.
subject.
You know what? It's the call of the chair, and I'll meet with the vice chair, and I'm looking to do another one. We might have to do it on a Wednesday or a Thursday, but we want outcome measures, and we don't want to lose that money. We mentioned about some money.
Thank you.
Too poor to lose money. I don't like losing money.
Thank you, Mr. Chairman, for your consideration.
But then, the director from Community Development can bring that back to us earlier, what Councilmember Hart said, because if we got some constraints on money, that's not good.
Thank you, Mr. Chairman.
All right. Let's move forward. So we'll meet again. I'll talk with the vice chair. We'll put it on the calendar. And we need to end this for finance, so we can go into finance. Thank you to everyone. We'll reach back out to the people here at the table here, and we'll continue it. And you'll look up about the money.
Absolutely.
All right, cool, thank you. With that, the Health and Arts Committee is adjourned, and we will move over to finance. Thank you.